Good morning. I'm Senator John Mannion, Chair of the Senate Standing Committee on Disabilities. It's 10 a.m. on Tuesday, September 14th, and the committee is convening this New York State Senate public hearing to evaluate the current workforce challenges within the system that serves New Yorkers with intellectual and developmental disabilities. I am joined by Ranking Member of the committee, Senator Martucci, and there may be some other senators as the hearing proceeds. I'd like to thank Senator Martucci for being here and the important work that he does. When I was named Disabilities Committee Chair, I said that I wanted to be a champion for this community, and I believe Senator Martucci is also committed to that, as are all other members of the committee. They feel as passionately as I do about helping. I'd also like to thank my staff, particularly the folks that put in a lot of time and effort into this. That would include Deanna Schneider and David Doyle, Anna Ortiz-Bravo from our Albany team, and also Colin Crowley, who's here today helping out, and my entire team, as well as the folks in the Senate that have made sure that this is going to go off without a hitch. This hearing is a significant action. It is the manifestation of a very real crisis that is taking place in communities across New York. There are simply not enough caring and compassionate New Yorkers who are pursuing employment working with the disabled. Low pay is clearly one of the reasons why this is happening, but it isn't the only reason or the only place where better state policies and investments could make a difference. We need to reframe the discussion and talk about developing career paths towards becoming a DSP, and we need to recruit more clinical staff such as nurses and mental health professionals. We need to work with our community colleges. We need to fund tuition credits and mentorships. We need to have a strategy that brings together job seekers with these challenging but rewarding and fulfilling positions. Who is doing these jobs now? Predominantly women, many of them women of color, many of them single mothers. People that we need to help out and make sure that they are earning a decent wage. We've begun addressing this crisis by rejecting the cuts that were proposed in the budget, and then also securing the first cost of living increase in over a decade. This is 10 years overdue. No employee anywhere should go without a raise, and the people that provide the service certainly deserve one. Our frontline healthcare heroes, and particularly those that we entrust with our most vulnerable, deserve to be valued. They deserve better pay. It was my honor to fight for it, but I also know that it is not enough. The victories we had in the budget must serve as a foundation for additional increases in the future, and that includes making sure that there's an increase in salary for our direct support professionals. New York State just received over $700 million from the federal government, and about $550 million of those are to help assist in pushing back against the workforce crisis that we are in. It will provide for things like longevity bonuses and hazard pay. We need to keep these programs and bonus in place moving forward, and that's part of the reason we meet here today. I'm calling today for New York State to match the federal investment and include $500 million in state resources in the next budget to begin moving the needle on this crisis. A problem of this magnitude requires a response of equal magnitude, and that's what's needed, and that's why we are here today, and that's why we are making that proposal. We know that the status quo is not sustainable. We are here today about the ramifications of decades of inadequate investments in the service delivery system for New Yorkers with intellectual or developmental disabilities. What happens to people, our loved ones, our friends and neighbors, when they can't access services? How many lives and families are disrupted by abrupt staffing changes? How many residents have closed, and how many more may close? What does all of this mean when things like this happen? It means people's lives are disrupted. It means that people have to leave the homes. And to me, that's totally unacceptable. We've received more than 36 written submissions from stakeholders unable to join us in person today. That testimony, as well as that of our witnesses, will be provided to every member of the New York State Senate. Today, we are joined by family advocates, self-advocates, providers, and other stakeholders, including DSP representatives. They come from every corner of New York, and I believe they have the greatest insight and perspective with the workforce crisis. Every effort was made to ensure our panelists are representative of OPWDD's service community. The OPWDD Commissioner, Commissioner Kastner, will be our first witness, and he'll remain for an extended conversation with the senators. The Commissioner will be leaving after our initial question and answer, and then we'll begin our witness portion of the public hearing. As the moderator, I expect all participants to be professional, adhere to time limits, and help uphold the decorum of the proceedings. All participants from the Commissioner on down are all here willingly and are eager to discuss today's topics. Those topics will be entirely related to the workforce crisis. Today, I hope to be a very thorough event, and it is dedicated to fighting the good fight and standing up and speaking out for a vulnerable population that needs our support and the people that provide that support. I'm looking forward to hearing from everyone. I would also like to welcome my colleague, Senator Mayer, who will be speaking soon. But right now, I'd like to offer a ranking member of the Committee on Disabilities, Senator Martucci, 5 minutes to make his opening remarks. Senator Martucci.
Thank you so much, Senator Mannion. Good morning, everyone. I want to begin by thanking my colleagues for joining me here today as well, and certainly thank you, Senator Mannion, to you and your team for putting this together. You've been a great advocate, and certainly I think we've worked well this year together. We made a good team, so thank you for putting this together today. In July, one of my colleagues who was unable to be here today, Senator Serino, and I were among the first to speak out about this workforce crisis that we face here at the release of a survey conducted by the New York Disability Advocates. I had personally, and my office had personally taken tearful calls from family members of loved ones of those who are needing care, imploring us to do something about this crisis that we face. Unfortunately, as we are all well aware, Governor Cuomo's scandals have distracted us from this important work and embroiled the legislature in months of back and forth, which has finally come to an end. So I'm glad we're here today putting this important issue dead in our sights. It's important to note that, in my opinion, in many ways, this crisis is one of the state's own making. If we go back to the general minimum wage increase across all sectors to $15 an hour, layer in a pandemic, enhanced unemployment benefits for the last 99 weeks, Medicaid and service cuts, and a failure to incentivize pay for direct care professionals properly, you end up with a perfect storm, which is where we are right now. Make no mistake, the jobs of direct care professionals are hard. They're very hard. They're harder than bagging groceries or stocking shelves, more necessary than working at a drive-through a fast food restaurant, and also more rewarding. But that said, working families cannot be expected to take a hit in order to work these jobs when easier and better paying jobs are readily available. The pandemic and the shortage of hospitality and other labor has only made wages climb even higher and has made this problem even worse. Last year, the Department of Budget cut vacancy Medicaid rates effective October 1st by $238 million. In June of 2020, OPWDD announced a $75 million cut to coordinated care organizations. I was very happy to see the Department of Health release a plan on July 12th to utilize some of the increase in the Federal Medical Assistance Funding, or the FMAP, to fund both bonuses and recruitment efforts in the direct care sector. This plan requires federal approval, and I would strongly urge Governor Hochul to press this issue with President Biden at her earliest opportunity. This is simply too important to wait. Moving forward, I hope we can maintain a united and bipartisan front on this issue. We cannot continue to add incentives on one hand and cut funding on the other. That's a shell game, and our DD-ID community is not a political chess piece. Finally, we have to begin by looking at the overall impact of the policy choices we make, not just the short-term political need. When government shut down the economy, incentivizes people not to go to work, allows people that are working not to pay their rent or utility bills, or inflates wages through mandates too quickly or too substantially, there are ripple effects everywhere. Overwhelmingly, that is our problem, and we need to stop it instead of operate with a scalpel rather than operating with the hatchet that we've been operating with. The law of unintended consequences from well-intended policies is what we're dealing with here. My ask to all of my colleagues is that we do whatever's necessary to help the DD/ID community meet its workforce needs and resist the temptation to take any other actions that may hurt the cause, either directly or indirectly, intentionally or unintentionally. Thank you.
Thank you, Senator Martucci. Senator Mayer?
Well, good morning all, and I will be very brief. Thank you, Senator Mannion, for your leadership. Thank you, Senator Martucci, for your passion as well on this issue. I'm not a member of this committee, but I am a longtime advocate on behalf of the staff and the individuals who are served in the IDDD community. And during COVID, the staffs of these providers just did heroic work. And early on, I went around in my community to say that they were heroes too. We had a tendency to acknowledge heroes and forget the staff that worked and took personal risk in, particularly in group residences during this time. And that is mixed with a real passion about those that are served in this community and their family members, who I believe have a voice that has not been heard. And I look forward to the testimony today in not only ensuring that we do a much better job for those who provide this care, but also for those they serve at the end of the day and their families. We have a real crisis on our hand with the workforce in the IDDD community. Today's a very welcome opportunity to hear from providers, from those who receive care, and from the institutional players in this field of how we can do better, and I look forward to everyone's testimony. Thank you.
Thank you, Senator Mayer. We're also joined by Senator Brooks. You're welcome.
Just real quick, I apologize for being late. We were, sorry. No? Okay, I apologize for being late. We were at a meeting in Schenectady, but this obviously is a critically important issue that we're dealing with. It is complicated as a result of the pandemic and what we're seeing there in terms of shortage of employees. And I hope we can start the process of coming out with some real solutions here and how we're going to address that. And I think we also have to recognize, for many of our families where we have folks with disabilities, we have senior parents who are caring for those individuals. And the biggest fear on their mind every day is that they pass before they can find someone who's going to take care of their child. So I think this is just critically important, what we're discussing today. We have to find a solution, and I believe that we have to find a career path for some of these folks that are helping these people, so there is an occupational growth that they see reflective of the experience and the time that they have in the job. So I'm glad to be here. I'm glad we're discussing this, and thank you, Mr. Chairman, for setting up this hearing.
Thank you, Senator Brooks. Just want to reiterate a few rules for everyone for this proceeding. Each witness who is not the OPWDD commissioner has 5 minutes to deliver their testimony. The chair and the ranking member will have 5 minutes to ask questions, and each senator that is not either the chair or the ranking member will have 3 minutes. We'll also have a second round of questions. We will begin with testimony from OPWDD Commissioner Dr. Theodore Kastner. Dr. Kastner has 15 minutes to deliver his testimony, followed by a question and answer session with the senators. On deck after that is Vijay Stasio. Dr. Kastner, you have the floor. Thank you for coming.
Good morning, Chairman Mannion, Ranking Member Martucci. Thank you, Senators Mayer and Brooks, for joining us today, and greetings to other members of the committee. I'm Ted Kastner, Commissioner of the New York State Office for People with Developmental Disabilities. Thank you for the opportunity to meet with you and speak about our workforce challenges. New York State OPWDD has recognized the increasing stress placed on the developmental disabilities workforce for both state and voluntary providers. Over the past 6 years, we've increased funding for DSPs by $710 million gross. This included a 2% increase in DSP compensation in January of 2020 and another 2% increase in April of 2020. Further, we recognize the impact that COVID has had on our workforce, only increasing the demands placed on our professionals. We agree that immediate action is needed to ensure that the people we support will have the staff that we need. OPWDD is fortunate that we'll be receiving supplemental one-time funding through the American Rescue Plan Act of 2021. In late August, the Federal Centers for Medicare and Medicaid Services issued partial approval of New York State's draft plan. In response, last week, we submitted an Appendix K to CMS for their approval. The Appendix K will temporarily modify our waiver and give OPWDD the authority to act upon the plan. Our submission included extraordinary measures to support DSPs. We will invest $514 million in payments to increase the wages of DSPs. The plan proposes 3 measures. First, a longevity and retention bonus, which will provide supplemental payments equivalent to a 20% increase in DSP compensation. Second, a supplemental one-time payment to support current DSPs and family care providers who worked during the pandemic and remain employed. And third, a bonus if the worker is fully vaccinated. In addition, OPWDD will make grants to waiver providers, associations, and higher education institutions that demonstrate increased DSP completion of third-party validated credentials or standardized competencies. In addition, OPWDD will fund grants to waiver providers and associations to implement strategies. Sure. No problem. Thank you. Strategies that will improve recruitment and retention, including funding a statewide multi-platform marketing initiative to promote careers in IDD supports and services, along with an independent evaluation to track and assess the effectiveness of the evaluation. The next step in getting funding will include OPWDD working with CMS to identify the exact amount of funding available and to secure those funds. Once this is accomplished, we will work with the service providers to ensure that they receive the correct distribution based upon their specific workers. Outside of these one-time funding initiatives through the American Rescue Plan, we have ongoing activities to improve recruitment and retention. In the fall of 2020, we launched the DSP Careers and Technical Education Pilot Program in partnership with the Capital Region BOCES, and we're working to replicate the program statewide. OPWDD and SUNY are collaborating to launch a new DSP immersion course through the SUNY for All online training center. Beginning in 2021, the pilot provided new and existing DSPs with free online training and in-person certifications at SUNY Educational Opportunity Centers, with statewide implementation expected in 2022. OPWDD continues to work with the SUNY Empire State College on a partnership to provide the workforce with access to scholarships, including a waiver of fees with college credits for prior training and experience. OPWDD has partnered with the New York State Division of Veterans Services to access the GI Bill Veterans Training and Apprenticeship Program. Veterans who join OPWDD workforce in selected titles and who meet eligibility requirements can receive a tax-free monthly stipend from the federal government for the duration of their traineeship. We continue to partner with the Regional Centers for Workforce Transformation through renewal of our 5-year contract, which will be using materials to establish validated competencies. We reach more than 96% of our providers through that program. We're working with state and federal partners to create a certification that can be used in standard occupational classifications. And finally, I'm pleased to announce that during DSP Week this week, effective the end of September, OPWDD will increase the starting salary for entry-level state-operated DSPs from a grade 7 to a salary grade 9. This will increase the effective starting salary by nearly $4,000 from $33,631 to $37,507 per year. OPWDD is fully committed to strengthening recruitment and retention initiatives to foster a high-quality workforce. We look forward to working with the legislature and all of our stakeholders in solutions to this crisis. Thank you again, and I'm pleased to answer any questions you may have.
Thank you, Commissioner. I appreciate that. And of course, I try to lean towards optimistic, and there's certainly some optimism there. Some things that we've committed to, and also things that we've already accomplished here, and acknowledging that there's a crisis and trying to propose solutions for those. That's very good news about the state workforce, and makes up about 20% of the folks that provide those services. Can you speak to sort of the overall vision of how we're going to make sure, we have that commitment to the other folks that receive services outside of the state process and facilities?
Sure. Overall, we believe that the DSPs, regardless of where they work, whether it's in voluntary or state-operated settings, are undercompensated. We have the means to address the starting wage for state-operated workers, and we're pleased that we can do that. For the workers on the voluntary side, the investments that we're making through the American Recovery Plan Act speak to the fact that we want to address the salaries on that side of the equation. They're below where they should be. A 20% increase is progress in moving in the right direction. So we're extremely pleased that we can make the kinds of investments that we're making this year.
Thank you, appreciate that. Back to the state-operated facilities. Fiscal year 2022, the budget recommended that there be 18,584 FTEs for OPWDD. Do you have the number of how many vacancies are there currently for clinical and DSP staff?
I do have that information for DSP staff. It's a little bit difficult to count because we have to look across different job titles and codes, but we identified 9,870 DSP full-time equivalents in March 2020. The number of positions that is filled has dropped below that to 8,798. It's a drop of about 12% as of August 21st, 2021. Now, that is a concern, but we do have some promising data. Between July and August of 2021, the short form applications, which we created a short form application to enhance the process, increased by 58% from 478 to 748 submissions. Between the first and second quarter of this year, fiscal year, we also saw an increase in new employee orientations, increased by 34%. So both of those speak to, we hope, a bottoming out that occurred sometime earlier in this year, and we are optimistic, or at least encouraged, that we can make some progress in closing the gap that we have in terms of the fill rate.
Thank you for that. I appreciate that. And this will be my last one, I believe. Those investments are important and necessary, and everybody acknowledges that, especially those that are proposed from the enhanced FMAP dollars. Are there, speculating to the 507 plan, are there workforce investments that are being proposed in that plan to make sure that we can sustain the commitment or the investment to the workforce?
Well, I can't speak to the 507 plan as of yet. It's still under internal review. Sure. I think if you would like a sneak preview, I think, if you will, I think the EFMAP plan is part of the state plan that's on the Department of Health website. It's a good place to look to see what our investments will look like over the next year or two. We agree about the importance of trying to sustain the increases that we are proposing. Although they're one-time increases, we want to look for opportunities to make those permanent. We will work through the budget process to try to accomplish that.
Yes, thank you for that. And I'm sure there'll be a lot of advocacy in our House as well. Senator Martucci has 5 minutes.
Thank you. Thank you, Senator Mannion. Dr. Kastner, good to see you. My question is specific to the rate-setting redesign that's currently taking place now. With respect to, so first I'll start by saying it's great to hear about the increases to the folks that are working on the state side of the equation, you know, the grade 7 to grade 9 pay increase for starting salaries. That's certainly a step in the right direction. But with respect to the rate-setting redesign, can you share a little bit about sort of like the methodology that you're going to employ to make sure that we've got the resources necessary to make sure that the folks on the voluntary side see those same sorts of wage supports?
You're talking about the residential rate
Yes.
redesign. Going back to 2020, we, working with stakeholders, realized we needed to develop a different payment methodology for our residential services. The current methodology is based on provider costs. Agencies with high costs receive higher rates, agencies with lower costs receive lower rates. There were questions about whether that was a fair and equitable approach. Many individuals expressed a concern that the funding available to the agency and which supported them did not match their needs. And we proposed an acuity-based payment methodology, which would tie the amount of funding to a residential provider to the needs of the individual. There's also a federal component to this. We have had an agreement with CMS to implement a high needs funding system. That agreement ended last year. We had a temporary extension because of COVID, but we need to come up with a long-term sustainable approach to funding the service needs of individuals with high needs in particular. The acuity-based approach addresses that. As to the sustainability of DSP salary increases in the rate redesign, there are no funds currently other than these one-time funds, so they would not be part of the rate process. If we can secure permanent support for those funds, we can roll that into the rates going forward. But right now they're not there because the funding isn't there.
Well, thank you, Dr. Kastner. I certainly think that you've got some partners here that are interested in continuing this conversation with you because I think from our perspective, that's a really important piece to making sure that folks have the resources to support these wages.
I'm sure I'll be back, so.
Excellent. Thank you so much. That's all the questions I have, Senator.
Senator Mayer?
Thank you, Commissioner. One question on the modification of grade 7 to grade 9, which goes to $37,000 as a starting salary, is that correct?
Correct.
Is that have a regional adjustment, or is that a statewide number?
I don't know, actually. We just completed the negotiations with the Office of Civil Services. I don't know about that detail.
Okay. And when would that be effective?
End of this month.
Okay, and secondly, over the years since 2020, there's been a substantial reduction, I think about 16%, in the number of staff at OPWDD facilities, state-run facilities, for a number of reasons, but there have been cutbacks in funding. What is the relationship between the reduction in staff and mandatory overtime at OPWDD-run facilities?
Well, as I said earlier, our fill rate looks like it's about 12% down. Overtime is interesting. I think one of the opportunities we have across our whole system is to look at that through the National Core Indicators, which is a process of collecting data, and it's aggregated by a third party. We can look at our experience relative to other states. In 2019, National Core Indicator data indicated that about 11.5% of all DSP hours were overtime hours. That's across the entire system. In 2020, we actually saw a decrease in overtime use, probably related to the fact that we closed center-based day programs. For all providers, OPWDD and the voluntaries, that increased effectively the workforce, the pool of staff available to work in residential settings. And overtime use dropped significantly in 2020. Now that day programs are effectively reopened, we're seeing an increase in overtime use, although I don't have specific data on the amount of overtime that's being used. We know that we need to be hiring more staff, and the things I've outlined are efforts to try to accomplish that.
So in anticipation of next year's budget and your request to the governor, a new governor who hopefully will be far more empathetic to the needs of those you serve and the caregivers themselves, Are you proposing a substantial budget increase for additional staff for OPWDD?
We haven't started the budget negotiations process at this point. Usually starts October, so.
And finally, what was the number of OPWDD staff who contracted COVID while at work and those that passed away?
I apologize, I didn't prepare for that question. We have that data, I believe it's online actually, although it's difficult to distinguish whether someone becomes infected at work or in the community at large. But we do have data on both staff infection rates and staff mortality. I apologize, I don't have that information.
Yeah, I'll stop, but I am very interested in what steps the agency took to deal with the risk of COVID, particularly in group homes, which I think was substantial and posed a real risk to caretakers and caregivers and families. And so I am quite interested in hearing the details about that. Thank
Well,
you.
as I said during my testimony about COVID, one of the remarkable outcomes of our system's work, not OPWDD, not voluntary, but everyone's effort, was that the transmission rate for people with intellectual and developmental disabilities within our system was actually lower than the transmission rate for that of the general population of the state of New York.
I appreciate that, but I'm asking about staff.
That incorporates staff, but staff, because they live in the community and work in the community, we have much less control over their risk profile and the activities that they engage in that might result in transmission. What we've said to staff is, well, we encourage vaccination. Vaccination is highly effective. We have very good vaccination uptake among our individuals living in residential settings. Our staff uptake is much lower. And for that reason, we've built in the incentives into the EFMAP plan to encourage staff to become fully vaccinated. We think that would go a long way to protecting staff and actually stabilizing the workforce, because staff who become exposed and they're not vaccinated need to be quarantined for 14 days. That's hugely disruptive. So we're strongly encouraging vaccine and putting money behind that effort right now.
Thank you.
Thanks.
Thank you, Senator Mayer. Thank you, and thank you, Commissioner. Certainly, the impacts of COVID in those facilities are a contributing factor to the DSP workforce issue that we're facing today. So I appreciate the question and appreciate the answer in this setting. Senator Brooks.
Thank you. Just to follow up on the issues associated with the virus, what percentage of your staff has been vaccinated?
Generally, staff runs about 35%. Excuse me?
35?
Yes, that's true. 35%. There's little differences, whether it's OPWDD versus voluntary, whether it's staff in residential versus staff in other community settings, but it's roughly 35%. It's quite low. It's very problematic to me. And again, we've incorporated incentives to try to encourage staff to voluntarily become vaccinated.
What kind of incentives?
Well, in the EFMAP program, there is one of the 3 bonuses is specifically to support staff who become vaccinated. The language that we're developing is to provide a certain amount of money to staff who would be vaccinated, fully vaccinated by December 1st of 2021. I think we're working with CMS right now on a dollar figure, but I can tell you it would be a substantial amount of funding for staff who voluntarily become immunized.
Oh, that wasn't it? I'm sorry. There you go. One of the tough things about being colorblind is you sometimes can't tell when a light's on or off. The 35% is a concern.
Absolutely.
Are you seeing any regional differences from one area of the state to another in terms of how many people are vaccinated?
There are some regional differences. There are some regional differences. I don't know if I need to go into them, but I was surprised actually to look at the vaccine rate in New York City, which was actually surprisingly low, much lower than the 35%. There are some pockets that in rural areas where it's lower, but it's across the board unacceptable, really.
Have you discussed with folks that aren't vaccinated, reasons why they're not doing that?
We've talked with our provider organizations, and when we work with OPWDD, we do talk to our staff, and every reason you could imagine that's been in the press is a reason that someone's cited.
Okay. Well, obviously, it's a concern, recognizing you're understaffed and then recognizing that those people that are not vaccinated have a higher potential of becoming ill. So that's a big concern. Just on the staffing for a section, do you feel you have a bigger problem attracting people to take the job or retaining those that are in the job?
We have multiple challenges in attracting people to the field and retaining them in the field. And I think for that reason, the multiple prong approach that we're taking around training, education, credentialing, in addition to compensation, is the right way to go. We're literally doing everything we can possibly think of to make the field attractive and provide a living wage to the staff who make this career choice.
Well, I know you haven't started working on the budget yet, as you indicated, but I would hope that the department really is taking a hard look at where you are, where you have to go, and those challenges, and you're budgeting to address that, because, we're talking about people with high set of needs. And we're looking at an operation that right now is effectively understaffed and to the virus overexposed because of the lack of vaccination. So, it's really a concern, I have to say.
Senator, I completely agree with you, and my staff will tell you that we've had two priorities with regards to budgeting. Our first is to ensure that every New Yorker can get access to services. We do not want a waiting list. If you look back to 2019, we increased our waiver capacity by 20% over 5 years. We anticipate growing by 4% every year, supporting more and more New Yorkers. The second priority has always been DSPs. And we took a lot of heat in the last year about what has been called the 5-1, 10-1 budget cuts. We undertook those cuts specifically to spare DSPs from the 2% across the board that we would have otherwise had to implement. So our two priorities have been preserving access for all New Yorkers to the waiver and supporting our workforce to be able to support those individuals. We're committed to trying to find ways to support DSPs through this next budget cycle, and we look forward to working with you in accomplishing that.
Okay, thank you.
Thank you, Senator Brooks. Thank you, Commissioner. Joining us also is Senator Serino. Do you have any questions for the Commissioner?
Not right at the moment, but
Okay.
I wanted to say thank you for scheduling this hearing after receiving our letter. You did it right away, and I really greatly appreciate that.
We appreciate that comment. And we are going to go around for another 3 minutes with each of our senators here for another round of questions. And I'll try to be brief, so 3 minutes for each of us. First of all, Commissioner, what long-term ideas or concepts or policies will OPWDD be advancing, I guess, beyond the short term, to address the emergency that we're in? I think you've done a good job of saying a lot of the things, but in the very, very long term, are there any policy, hard set policy changes?
In regards to DSPs, or?
Yes.
Well, I think, as I described it, generally we want to improve the quality of education, training, credentialing, work to get the position identified by OSHA as a certified position. We want to look at compensation. It was remarkable for us. We were developing the budget proposal, the EFMAP proposal, while at the same time celebrating Juneteenth. And I remember people talking about the idea of buying your time. And we were thrilled to be able to come to you and be able to say that this proposal would allow staff to earn as much in 5 days as they could have earned in 6. That we bought people's time. We're trying to help folks have a manageable lifestyle which incorporates a balance of work, family, and other activities that they might choose. Some staff may want to continue to work overtime, which is fine, but at least we're creating that flexibility that makes this a job that someone can hold for their entire life with the support that they need. So, you know, we welcome this opportunity to
Sure.
have this discussion. We are fully behind this. We'll look for ways that we can to sustain this.
Thank you very much. What is OPWDD currently doing to help agencies that have a staffing crisis? If the agency is unable to staff shifts, is there, you know, a protocol that OPWDD follows to try to assist?
Well, going back to the onset of the COVID pandemic, we did obviously have staff challenges, and we created flexibilities at that point around postponing certain regulatory activities, extending training certifications, allowing agencies more flexibility in moving staff between sites. Those are, for the most part, in place. We hope that they're helpful. Obviously, they're not going to solve the problem entirely. We need more people.
Thank you, I appreciate that. Last one quickly, do you have an estimate on how many individuals on emergency lists or otherwise are awaiting placement in programs that are not being served by staff shortages?
I apologize, I don't.
Yeah, I guess how many people are awaiting, you know, awaiting services due to staffing? Is there any estimate on that? How many individuals?
I
Yeah.
couldn't
Sure.
estimate. I mean, I think you might be suggesting, or is it residential services or day programs? It's difficult to know on the day program side because we created new flexibilities as alternatives to day programs. We now fund the remote delivery of services for people who live with their families. We fund community habilitation and its delivery in residential settings as an alternative to day programs. So we clearly are using less day program than we used to, but we're delivering services in new ways. And those two methodologies were made permanent in our waiver revisions earlier this year. So the day activity space is really very fluid and difficult for us to understand exactly what a waiting list might be. Residential, we have better data, and I think I've said this before, we're able to support everyone who has an emergency need for residential services.
Thank you, appreciate the answer to the vague-ish question. Senator Martucci, 3 minutes.
Thanks, Senator Mannion. So Dr. Kastner, I know one of the big challenges certainly here as well is the fact that we don't have a standard occupational classification through the Bureau of Labor Statistics to even really understand globally the size of this. Sort of anecdotally, we've got some evidence. You have certainly some departmental evidence. We have a whole industry that sits behind you of professionals who know how bad this crisis is that we face. And one of the things that I think is most interesting are some of the partnerships you were talking about, Empire State College and others, where you're really going to be focusing on creating this career ladder, so to speak, approach in terms of offering folks an opportunity to grow and further their careers, which I think is really important because as we've seen, you know, sort of like this is precipitated by several things: a lack of public awareness about DSPs, what they do, their jobs themselves, coupled with the obvious issue of low wages, which we have to address, and others. But could you just share a little bit more sort of about what you think those opportunities look like with respect to the career ladder? Because it's something that I've got a lot of interest in, and certainly I think some others here would be interested in being helpful to advance your thoughts on that if you can share a little more.
I'm sure. Well, you probably may not know I was a DSP in 1976. I'm sort of a black swan now sitting before you as a commissioner, but I believe there are opportunities for people who are committed to the field, but no one can be expected to work in a field that doesn't compensate them or support them adequately. If I were a DSP earning $30,000 a year and trying to support a family, it would be a huge challenge to me to want to be in this field. If we can increase the base salary to $36,000, I think that's a step in the right direction. I won't say that that's the end goal in our discussion, but certainly an improvement. I can't speak to the ladder that exists within the nonprofits, but time, education, and enough money to be able to support your family are three things that every worker needs to have, and we've got to do a better job in addressing those three, you know, kind of core goals for staff. The people who want to take advantage of education will do that. People who want to advance their careers will do that. But we've got to remove the impediments to their moving forward.
Thank you, Senator Martucci. Senator Math?
Thank you. On the CMS partial approval of your waiver request, you mentioned in your testimony three things: a longevity and retention bonus to provide a supplemental payment equivalent to 20% increase in DSP compensation. How many individuals would receive that, and what is the average amount of that supplemental, which I take as a one-time increase?
That increase would be available to everyone who is considered a direct support professional. I know we have some challenges with counting, but it's upwards of 100,000 people on the voluntary and state side together. Voluntary is probably 85,000 people.
So this includes voluntary and state employees, and what is the?
No, voluntary, not state.
Oh,
State are
just-
subject to the collective bargaining agreement. and
Okay.
More of a challenge, but this is solely for the voluntary.
And what is the average amount of the supplemental payment?
Well, the average wage for a DSP in New York State, based on the National Core Indicators data 2019, is $15.31 an hour. With the 2% increases that happened in 2019, we think the average wage is about $16 an hour. Take 20%, you get to $19.20. Annualize that, which is multiplied by 2,000, you come in with about $38,400 as an average DSP wage.
Is this this number one issue that you raised, is that a one-time supplemental payment?
All three of those
They are.
enhancements are one-time using the
Okay.
EFMAP funds. We can't use those to annualize the increases. And so as we're here talking, I'm telling you, we are committed to trying to find ways to fully annualize those one-time expenses or opportunities. The EFMAP dollars are proposed to be spent over 2 years. If we get CMS approval, we hope that we can continue to fund that higher level of compensation over a 2-year period. If we can't, we'll come back and talk, I'm sure, in February about how we can try to sustain it going forward at that point.
Okay, just so I don't use up my time, a supplemental one-time payment for those who worked during the pandemic, how much is that anticipated to be?
We're negotiating that with CMS. They literally asked us, well, how did you pick the number? So we have to go back and work with them
Well,
on
can I
a-
ask what the number you picked?
I believe we suggested to CMS $1,000, but
$1,000 bonus pay for the time worked by voluntary DSPs during COVID?
correct.
A one-time $1,000 payment?
Correct.
Okay, thank
But
you.
that was our initiative. That was our ask. I don't know if that's going to come through. Really depends on what CMS says.
And what is the bonus if the worker is fully vaccinated? What is your anticipated number?
Our ask was the same, $1,000. I don't know if that'll be approved by CMS. It's, again, subject to negotiation.
Okay, thank you
It's a
very much.
significant amount of funding for both.
Well, it's a significant amount of funding in your ask, but to an individual employee who worked during COVID, I would respectfully disagree. But
Well, I'm totally with you on the fact that we need to do a better job compensating our workers, that they undertook significant risks and hazards in the course of their duties in the last year and a half. I completely understand that. But $1,000 per DSP times 100,000 DSPs is $100 million.
understood.
So it's a lot of money.
I
and-
understand, Commissioner, I get that.
Okay.
Thank you, that's it on this part. Thank you very much.
All right, let's see how we do with the vote. Okay.
Yes.
Okay. A couple of quick questions. What is the retention rate on your staffing from year to year?
For DSPs, I'd have to go back and look, but I think we have somewhere on the order of a low 30% turnover rate on DSPs across the state. It's better than-
You retain 30% of your staff when?
No, we
when
turn
you're
over. We lose
Oh,
about
okay.
30%
Okay, I'm
here.
sorry. What's the growth rate in clients each year, patients?
As I mentioned earlier, our waiver ceiling was increased by 20% in 2019, and that's a 5-year agreement with CMS. So we've actually created 4% more capacity in our waiver each year.
Okay. Would you happen to know the infection rate from the virus of your staff and of your patients?
I did say we have about 88%, I'm sorry, infection rate?
Yeah, the infection rate.
The last data that I looked at for September 3rd, I think we had about 96 positives for the week of September 3rd across the entire system.
And what percentage of that is of your staff?
Just 100,000 individuals, that's less than 1%.
Okay.
It's less than 1/10%.
All right. And the
But-
clients?
That's clients, that is individuals. I don't have staff.
Okay.
But I have to say, we were at 0 for a good part of the summer. So even though 96 out of 100,000 is a small number, it is alarming
Yeah.
because those are individuals that we need to protect. We've had hospitalizations. We actually had a death last week and a death the week before. We'd gone for 4 months with a total of 2 deaths. So we're
I mean,
concerned.
it's a concern where you are without question.
And we believe that masks and vaccines are the most effective tools that we have, and we are strongly encouraging their use.
Okay. Thank you.
Thank you.
The button. Commissioner, thank you for coming today. I appreciate your testimony and your willingness to ask questions, even though myself was a little repetitive one time. I do appreciate that. And of course, I thank the office and yourself for the commitment and the acknowledgement that we still have a long way to go, but we hopefully are moving in the right direction, and really appreciate your time today. Thank you for your testimony.
Well, and I want to thank all of you. I mean, this is kind of pro forma, I have to say, thank you and all, but I really mean it. I know that you are trying to help us. I hope you know that we are trying to help you, that we can't operate our system without a stable, high-quality workforce. And I think we're all on the same team trying to move forward. So I really appreciate your effort in being here and the support that you've given us. So thank you.
Thank you, Commissioner. Our next witness will be BJ Stasio, a self-advocate representing the Self-Advocacy Association of New York State. And after that will be Tom McElvanna. BJ has 5 minutes for testimony, and then myself and Ranking Member Martucci can ask 5 minutes of questions. Other senators can ask 3.
Great.
Mr. Stasio.
Thank you. Hello, everyone. I'm proud to be here on behalf of self-advocates and families today. Thank you for the opportunity to speak. The staffing crisis is not a matter of statistics. It is impacting real people, and real people are suffering because their needs are not being met. This is a problem in all settings, self-direction, certified, and also the Consumer-Directed Personal Care Assistance Program. So the problem is with both OPWDD and DOH services. Now I'm going to take a minute to tell you a little bit about my story. I have been without a Consumer-Directed Personal Care Assistant for 2 years, which means all the work falls on my self-directed staff, and they are only allowed to do certain things for me. They are not allowed to do the personal care that I need, the bathrooming help, so it's a real detriment. And I am currently, to be honest with you, due to the lack of staffing for me, been sleeping in my wheelchair for the past 2 years because I have no help in the morning whatsoever. And I work for OPWDD when I'm not saying he's president, so I have to get myself motivated and get ready to do my work for all the individuals that I serve in Western New York. And I know some stories of some people who are going through the same things, and they've been threatened with going back to the group home if they don't get the supports that they need and it tears me up inside to hear that from them. Nobody should have to hear that from anybody. Our choices matter, so please remember that. Sure. You know, it's just a matter of common sense. We all need the help, and yes, we are going through yet another pandemic of this staffing crisis. I don't think it's fair that we have 2 pandemics we have to suffer through. Because for me, the pandemic of the staffing crisis is much worse than COVID because it affects my life and those of New Yorkers with intellectual and developmental disabilities. So I beg upon everyone in New York State, rise up and do something to help yourselves and help others, please. As I said, people are actually going without staff support at times, and they have real unmet needs that diminish their quality of life and sense of personal dignity. As far as personal dignity goes, it's very difficult for me, the self-advocate that I am, to ask a random stranger in my building for help with my bathroom needs when there's nobody there, but I have to do it to have that good life that OPWDD promises. People are seeing staff leave at an alarming rate. More and more they are being served by staff who they do not know, often with very intimate and personal details, because a record, when staff have to read it when they don't know the person, does not describe the person currently. Because if you have staff who are working with people and just starting, they don't have time to read the record. They have to get right in and take care of people. The needs which can place them at risk or harm can also be a humiliating experience, as I mentioned. In all settings, we are finding that we have less and less choice and control over the direction of our lives. Over the last 10 years, our lives have gotten worse when what we needed was innovation and improvements to make our lives more person-centered. The state is failing us, and it's a sad state of affairs. New York State, for me, is the best place to live, so let's all step up and do something, please. All of us.
BJ, thank you.
Thanks so much.
Everybody here is not surprised, and we appreciate your advocacy. A couple things about what you had mentioned. A couple quick questions, and 5 minutes for the chair and the ranker. Can you tell me either your own personal experience or what you know about individuals who are in OPWDD self-direction, and how do they go about finding that qualified staff?
Well, to be honest, for me, the agency which serves me is an awesome agency, but their road to give me services is you find the people and we'll hire them, but it takes so long to onboard them, it's almost ridiculous. I've had to go up to people in grocery stores, hey, you look like you need a job, want to come work for me?
Something. You talked about, we all agree, you should, listen, we love you, you're a great recruiter, but you're not supposed to have to do those things, we all agree that. So you mentioned choice and control. What flexibility is out there in the guidelines that OPWDD provides, or alternatively, what restrictions are there to provide people with competitive living wages? I hope I was clear on the question.
Yeah, to be honest, not much when you have to wait for services. What OPWDD really needs to focus on, and I'm glad the commissioner is here and we had an opportunity to talk before, is to get more people engaged in their advocacy lives and make the documents that people are forced to understand in an easy read document so everybody can understand it, because questions delay the services we need. And if we can avoid the minutia of the questions, people will get the services that they need.
Thank you. Last one for me. You mentioned innovation and improvement, and we've known each other a little while here, and I've heard those words from you. So, in your own words also, what are those innovations and improvements that, you know, in the short time we have here, you could put out there that
Well,
might be obvious to you?
Well, to be honest, I wish OPWDD would focus more on being person-centered instead of just talking about it. I've been waiting for person-centered services to really happen for so long. Just having a person at a meeting about themselves is not truly being person-centered. So get it together, OPW, please.
Thank you, BJ. Senator Martucci.
Thanks, Senator Mannion. So BJ, my first time meeting you in person, and you are even more dynamic in person than on Zoom. And I would tell you that comes as no surprise, but great to see you in person.
Thank you.
I want to continue along the lines where Senator Mannion was going and use my time to ask you a couple of questions. What else from your perspective, when you talk about innovation, is important?
Help people understand their rights, because if you understand your rights, you can make the educated choice that you need to make for yourself. We need to have a larger discussion about rights. Rights is not a regulation. Rights is guaranteed by all of us as human beings and United States citizens.
Absolutely. Well, BJ, I want to say thank you, and I look forward to continued discussions with you. Thank you for the great work that you do. You do amazing work on behalf of so many folks, and you should be very proud.
Thank you so much.
BJ, pleasure to meet you, and thank you for speaking with such a strong and loud voice, and I hope OPWDD heard you. Question, you are both in the CDPAP program, correct?
Yes.
So when you're looking for someone to take on this role of provider, what is the pay that can be offered to them?
Well, in Western New York, where I'm from, it's a sad $12.90 an hour, and my life is more than $12.90 an hour. And so is everybody else's. Even the 15 that I know are in Long Island, they should be getting more than that, because personal care affects my life, and it's a lot for somebody to do. So please raise those wages and make the staff feel valued and make us feel valued as well.
And during this time when you're not able to find someone for that pay to do this very difficult and personal work, you've relied on your neighbors in your building and put off things that you need to do.
Yeah.
Does OPWDD have a response when you can't find someone to do this job?
Not really, honestly, because the CDPAP program is not covered by OPWDD. It's covered by Department of Health.
Does the Department of Health have any response to you? You're basically out there without the services to which you are entitled.
Well, the usual response is, we'll renew your services, but when you find people, tell us, and that's ridiculous, because how am I going to sit there and say, come to work for me, only get $12.90 an hour? I would never do that to anybody, because human beings have a lot more value to me than $12.90 an hour.
Agreed. Thank you very much.
Let's see what happens this time.
Senator Serino.
BJ, it's so nice to meet you today, and oh my God, your testimony is so, like, I'm sure everybody here can feel your passion, and I can't even imagine sleeping in a wheelchair for 2 years, even for a couple days, and not having the care that you need and that you deserve. So I'm so glad that we're doing this hearing, and that things have to come out of this, so that you have the help that you need that we're able to pay the providers more money, like you said. It's so important, and I just can't thank you enough for being such an advocate for so many people.
But I must say, this is not about me, it's about everybody with IDD and intellectual disabilities, because the minute I make it all about me and my needs, that is selfish of me, and I refuse to do that ever.
And I don't think anybody's taking it like that, BJ. I think.
But
you're-
I just have to say that.
No. That just says so much about you. But I think you're putting a face on what people are dealing with right now. And that's so important for the public to hear and for us to hear, because things have to change. They cannot continue status quo. So I just want to say thank you so much for being here today.
Thank you. Thank you.
BJ, that working?
I don't think so.
No.
Question?
You got it.
Okay. First, this is about you. It's about every you in the state of New York.
Yep.
Let me ask you a question. How many times are you asked what you need?
How many times have I asked what I need? Very few, because my focus is about everybody else and always going to be that way, because if I help everybody else, it then helps me, because if they get the help they need, maybe that person will want to work for me. So my first goal is to get somebody else's needs taken care of, then I focus on me, but I don't like when I'm asked what are my needs, because I don't want to be looked upon as forgetting about those who are voiceless, who are learning to be self-advocates.
I don't mean that question to be self-centered.
No,
You-
I know.
You know what you're capable of doing, and you know where you need assistance.
Yes.
How many times are you asked that question?
Well, by DOH, quite a bit, because I have to prove to them I have a disability every 6 months, and my disability is lifelong and it's not going to change. I hate to tell them that, but it's never going to change.
So time is spent asking you the question that after it was asked the 25th time is still the same.
Yes, still the same. And as I get older, it gets worse. But, that happens to all of us as we get older. But I need the help now, and so do other people around New York State.
I don't question the fact that other people in New York State need help. You do a pretty good job expressing your needs and yourself and your opinion. And my question is, rather than asking you a question that's not going to change, there should be some kind of discussion of what progress you're making or what deterioration you're having, so we alter what we're doing to give you better assistance. So my real question in terms of asking you what you need is whether or not we have a discussion with you, not talking about you, but you, to see what is happening, what direction you might be moving in certain things, if things are getting more challenging or less challenging in certain areas, so that we're adjusting the program for you and perhaps making the people that are working for you more effective.
I totally agree with you, because you know what that is? Truly being person-centered across systems.
Right. So I take from that, there isn't a discussion with you.
No, never a discussion. It's just about what I need at the moment, and that's it. And what I need from day to day changes because my needs change. And I'm well aware of that.
Well, I would just tell you to continue to speak out. We're certainly going to listen. And we've got to recognize that you are all individuals. It's not a cookie cutter situation.
Thank
And
you
we
very
have
much
to
for
take
the
the time.
acknowledgement of that.
Well, we have to take the time to recognize everybody's an individual and evaluate where you are and make adjustments. So I thank you for being here.
Thank you.
Mr. Stasio, we all thank you for being here today, and of course, your continued passionate advocacy for others is clear. And it's great to see you. I appreciate the fact that we've come to know each other, and hopefully we're going to see each other pretty soon here.
Yeah,
Thank you,
trust
PJ.
me, we will.
I know. Thank you again. Our next witness is Tom McElvanna, President of New York Disabilities Advocates and Interagency Council of Developmental Disabilities, and on deck is Randy D'Antonio.
Good morning. First, I want to express how happy I am that I'm following BJ. He's a tough act. Good morning, and thank you, Senator Mannion, Ranking Member Senator Martucci, Senator Mayer, Senator Brooks, and Senator Serena. It's good to see you all in person. My name is Tom McElvanna. I'm the president of the New York Disability Advocates, or NYDA. It's a statewide coalition of 7 provider associations from Montauk to Buffalo. We are the Alliance of Long Island Agencies, the ARC of New York, CP of New York State, Developmental Disability Alliance of Western New York, the Interagency Council, the New York Alliance for Inclusion and Innovation, and the New York Association of Emerging and Multicultural Providers. We represent more than 300 not-for-profit agencies that are responsible for providing vital services and supports for over 320,000 New Yorkers. Our collective vision has remained always the delivery of high-quality, person-centered services, care, and supports to people with developmental disabilities and their families. I want to break this testimony into, and you have copies of the testimony, I'm assuming, into some of our results of our recent statewide workforce survey that included establishment of a living wage and other recommendations for recruitment and retention, as well as some comments on our fiscal status. First of all, it is DSP week. Happy DSP week to all DSPs, past, present, and hopefully future. As you know, DSPs are a vital part of New York's care economy and are the backbone of the system of services and supports for people with intellectual and developmental disabilities, and as well as their families. They're employed by not-for-profit agencies directly to individuals to provide vital services and supports in group residential settings, independent apartments and homes, and in recreational and therapeutic day support services, as well as employment. The role of a DSP is not an easy one, requiring a high degree of responsibility, skill, and compassion. DSPs are essential to ensuring individuals are leading safe, fulfilling lives in communities and receive attention for their complex medical and therapeutic needs. There is certainly not enough of caring and compassionate New Yorkers that are taking this job. NYDA conducted a workforce summit in early June. We recently conducted a statewide survey to quantify the reports from provider agencies that all of us have been hearing, highlighting the increasing and significant staff vacancies among DSPs. Statewide, the average DSP vacancy is approximately 25%. 1 in 4 positions are vacant, which is a real dire picture for our service system. A 25% vacancy is nearly a 75% increase in the staff vacancy rate from pre-pandemic levels. To highlight the staff shortage, nearly 70% of the agencies statewide reported supervisory staff needed to cover shifts just to maintain staffing levels. Nearly half of the agency had to close programs or reduce operations. 93% of providers have seen numbers of job applicants drop from pre-pandemic levels. So certainly, we have recommendations that we hope to identify and address this critical workforce emergency. One is the establishment of a living wage. A number of factors obviously affect DSPs and the wages they receive. The increases made in work in industries such as fast food and big box stores have made it more lucrative than direct care work. Historically, DSPs' wages were significantly higher than minimum wage, at some estimates 20 to 40% higher. But due to years of lack of investment and cuts to the system, wages are at minimum wage now or barely above in the state. This workforce survey chronicled that the average wage across the state in residential programs is $15.42, In day services and employment, it's $15.88, and in community hab, it's $15.76. Through previous efforts, notably the Be Fair to Direct Care campaign, 2% increases for direct staff were secured. However, due to budget neutrality factors that OPWDD applies to the providers' rates, funding that was meant to increase salaries was really reduced in other ways through the provider rate methodology. Additionally, provider agencies have not received the statutory cost of living adjustment for nearly a decade. The last one was 2010. I think we received a 0.2% increase about 4 or 5 years ago. We are pleased that we were able to work with all of you to get that 1% increase here, and we hope to be able to sustain it in the years to come at an even greater pace. It is essential that meaningful steps are taken to establish and implement and fund a living wage so that our DSP workforce and our agencies can sustain the quality services we believe in. Other recruitment, I guess I'm getting down on time, but recruitment strategies that have been listed in the paper include standard occupation classification. I think Senator Martucci mentioned that. The expansion of the BOCES High School pipeline program to fund individuals coming into the system and do some job mentoring. Expansion investment in the summer youth program, a statewide marketing campaign. In terms of retention, the establishment of a DSP credentialing program. You should hear from other folks here, which is a multi-tiered credential program for DSPs with a hybrid learning model to increase pay for individuals as they complete each tier of the credential. Establishing a career ladder and creating a DSP employment tax credit. Programs like that would increase DSP tenure, job satisfaction, and provide workers with a career path. So we recommend establishing a personal income tax credit for DSPs of $2,500, which is especially critical in the rising minimum wage. And lastly, fiscally, OPWDD is undertaking the rate methodology, as you heard. This rate methodology, we believe, has to include provisions that ensure that new rates to pay direct care staff will pay a living wage, and that any rate reductions that any agencies may receive will not impinge upon their ability to maintain the living wage or the salaries of the direct care staff. And if I just comment quickly on something that BJ just said, you know, he mentioned the fact that it's not about the data, that it's about real lives. And I think you all recognize that. And I want to also say that by the nature of your questions, you obviously have a sense of what the problem is. We are very, very hopeful that the new governor will be able to provide us with opportunities to listen and also maybe work together on this. Because agencies right now cannot open day programs. Many of them, folks are ready to come back, they don't have the staff. The mandated overtime is wearing them out. Parents, as you heard outside in the rally, there's not enough to go, a staff person to go to a movies, to go into the community for a walk, or to go to program. And I know people like BJ are tired if they find somebody, they're tired of breaking in new people who leave just in time when they get to know exactly how to support that person. So please, we know that you're working with us, we appreciate that, but we need immediate relief and sustainable funding, or we will see a continued crumbling of our system.
Thank you, Mr. McElvanna. How much does it cost to train a DSP?
You know, the last estimate I had seen, it was the University of Minnesota had done a number of research work in that area, and it was somewhere in the neighborhood of $4,000 to bring a new person in and to provide the training necessary to get them on the job. So we continue to repeat that as you continue to go through staff.
And is the turnover rate consistent in like your agencies or a typical agency compared to what the commissioner referred to, that frequent of turnover?
The turnover, again, we had, the pandemic was one of those, you know, anomaly period. So turnover rate prior to the National Core Indicator Survey that over 30 states in the union filled out, and New York State as well conducted it. And it had our turnover rate somewhere in the north of 35, 36%. Previous years, the one turnover rate that NIDA had performed 2 years ago, we had it somewhere 25 to 27%. So we have seen a dramatic increase. What is really alarming though is now the vacancy rate. Now that people are leaving, who have stayed there. They believe in what we do, and they believe in what they do, and they often leave crying because they are so attached to the people that they support. but they can't sustain it or they can't sustain their lives economically.
Thank you. Are there any regulatory changes or greater flexibilities that you believe would be necessary and would help to make it easier for agencies to recruit and retain staff? So is there any too restrictive regulations that need to be changed and more flexibility?
We have tried to work with OPWDD to get meaningful change in regulations. We have, so there clearly has been efforts made. It is very difficult. We have a very, very strict level of oversight and compliance, which certainly on one sense we support and understand, but at the other sense that we are very often hit with mandates that clearly are way over the top. You know, we've had OPWDD, while it was mandated to take a look to make sure that during the pandemic everything was doing the right thing, we had surveys that were coming in, knocking on the door during the pandemic in a hazmat suit and counting how many, hand sanitizer bottles were there. So these are the kinds of things with that level of oversight that continue to, haunt us, and we wind up becoming more checking off boxes as more than actually having direct support and care to the individual.
Thank you. Last one for me. Do you believe that the federal funding that was provided from FEMA or from, through funding for PPP, did that stave off, agencies from closing? How impactful was that funding, and if it had not arrived?
Well, we haven't received any of it, and we are very, very hopeful. I think we were encouraged, the provider community was very encouraged with the proposal that OPWDD made, that it was great to have that one-time infusion, but we really need beyond a one-time infusion. We need a permanent solution to the workforce crisis. It is obviously, as we indicated here, it's going to take more than money. Money's not everything, but that's the start. Mm-hmm. And when we are looking and competing with Target to get employees, that's not New York's noble cause and their moral and legal responsibility to people who are some of New York's most vulnerable citizens.
Thank you. Senator Martucci?
Thank you, Chair. Thank you for coming. Great to see you as always. So one of my questions, and I talked about it a little bit in my opening, was some good intention policies that I think have made life more difficult for you. And you were just talking about you saw a significant drop off in applicants post-COVID. Do you think that the enhanced unemployment has had an impact on that or anything to do with the number
I'm sorry,
of folks?
what was that again?
The federal enhanced unemployment payments. Do you think that's been a contributing factor at all in terms of fewer applicants?
I think there's a number of factors. That certainly can be one of them. I think there's, you have to remember that more than 70% of our workforce are women. The majority of are people of color. So we have a lot of folks who are, need to be home for childcare. They have their kids home from school. It has really thrown everybody out for a loop. We believe that's partially a contributing factor, but there's so many things because everything is so individualized. And so the pandemic certainly has made everything worse.
Sure, and then just my second question is, as you were concluding with the chairman, you were saying that, money's not all of it. There's certainly some other pieces, and I think you've made some great recommendations in your written testimony and what you provided today. But in terms of the recruitment piece, do you see there being some value in some sort of statewide marketing campaign or advertising campaign behind something like this? I know you mentioned it in your piece, so.
Yes, and it is in our report. We talked about, trying to develop a marketing of what the DSP profession is. I know some of my colleagues, including Joe Macbeth from NADSP, will be able to even talk probably with a bit more with clarity than I will. But we have, over the years, especially in the early years, and I've been around for a bit, but there was it was marketing campaigns to educate the public on what having a group home in your neighborhood really was. Now, certainly we're not doing that anymore. We want to have people more out in the community and more individualized. But we can use the power that the state has to be able to suggest that this is a noble profession, that this is recognized as something that not only benefits the society at large, but individuals with disabilities. And if we provide them with a living wage, with the education that they need, then I think it would be a lot more attractive.
Great. Thank you for your work and your testimony. Appreciate it.
Senator Serino?
Thank you, and thank you so much for being here today.
Thank you.
Know, I'm someone that didn't take the traditional college path, so I liked reading about the expansion of the BOCES High School Pipeline Program that you guys did in the Capital Region. And I was just wondering, because I love the idea of expanding that to the state, how successful have they been? I don't know if you have any data on that yet.
I don't have the data on that one.
Okay.
We can probably get back to you on that and give you a little bit more information than I'll be able to share with you today. But my understanding is that in the little pockets that where it exists, we do find that people get very enthusiastic, that many young people want to be able to have a job that is meaningful, where they can give back. Many of them have brothers and sisters with disabilities. Many of the people who come in to do this work have that background and that understanding and that caring and compassion. So, but we can get you some more information on it for sure.
Yeah, I love that, and like Senator
Great.
Martucci spoke about the marketing idea. I think, right, it's always all about marketing and marketing to young people, right? You know, sometimes I feel that we start too late. By high school, we really have to start in middle school having those conversations, and I just, I thank you for bringing this up.
Great.
And thank you for everything.
Thank
do.
you. Good for you.
Thank you, Mr. McElvanna. I appreciate everything you do, the work that you do, and your testimony today, and look forward to working with you moving forward. Thanks
Good.
again.
Thank you, Senator. Thank you, everyone.
Thank you. Next witness is Randy D'Antonio, Vice President of the Public Employees Federation. We will have a slight change in program. Next up will be Leslie Feinberg.
Good afternoon, Senator Mannion and other distinguished members. Thank you so much for having this hearing today. I am, as you mentioned, the Vice President of the Public Employees Federation, but I am also a licensed master social worker who's worked for OPWDD for the last 25 years. PAF members provide clinical and medical services to those in our care. While it's a hard job, and most of us went into this field knowing that we were working in human services, people felt satisfied at the end of the day that they made a positive change in people's lives. This current crisis that we're in is unfortunately not a surprise to many of us in the field. It has been developing over the last decade, and PAF has been raising the alarm at these hearings for many, many years. But I need to say it wasn't always like this. New York State OPWDD used to be considered one of the best service systems for individuals with developmental disabilities. Families used to move to New York to get services. That has drastically changed over the last decade. The state in 2011 began the ill-advised transformation agenda under the former governor. That agenda was touted as being the fix to making services more inclusive, to giving more choices for people, to bettering the service system. And frankly, we were sold a bill of goods. 10 years, we've seen services decimated. We've seen a reduced workforce. For PAF members, we've lost over 1,000 PAF members since 2011. Now let me say this, PAF consists of nurses, of doctors, of social workers, physical therapists, occupational therapists. So that 1,000-person loss equates to services being lost. It equates to supports for people with disabilities being lost. It equates to families being left on their own and to their own devices to try to figure out how to get services. Under the guise of Olmstead, which we all support and agree with, that people should live in the least restrictive setting, they decimated entire levels of care. We have closed over 3,139 group home beds. Up until 2019, the state will not give us additional data of how many they've closed since COVID. We know by anecdotal information that there's been well over 100 more group homes closed. We also know that they closed over 1,300 inpatient beds. And all you need to do is look at any newspaper in any community with families struggling to make choices of what do I do with my loved one who has severe disabilities, who might have psychiatric issues, who may have behavioral issues, and who are trying to just manage and keep things together in their own homes. I talk to parents who tell me they've had to quit their jobs because the state doesn't have a place to provide services. The transformation agenda again, led to artificial and self-imposed austerity budgets, which still exist despite monies coming into the state. We are still operating under budgets that don't allow us to buy paper and pens, don't allow us to provide for necessary services for people. It is absolutely shameful. This agenda needs to be reversed. Somebody asked earlier, I believe, how much overtime was worked, and we do have that information. OPW, I'll find it for you. I believe it was 19 million hours in total of overtime for state workers, but in OPW, I believe, give me 1 second, I apologize. I believe it's in your testimony, but it was a significant amount. I mean, it was 160-something million, I believe, in overtime just in 2020. That really speaks to the level of staffing shortages we have. And what it also speaks to is the burnout. People are being burned out. The morale is so low that despite recruitment efforts, we can't retain professionals. They are disrespected. Their clinical input is not heard. They are not being asked to be part of the solution when we're planning for individuals. These are decisions being made at a management level, and they're often not in the best interest of the people we serve. OPW failed to solicit feedback from the professionals, and we ask for your help in making sure that doesn't continue moving forward. We really have an opportunity here, and I am hopeful that with the new governor, with all of your support, that we can actually turn the tides of what's been happening to our system for the last 10 years. PEF members support people with disabilities. We want to see our communities thrive. We want to see our communities being funded, and we want to fund these services adequately so that no one falls between the cracks and no one is left without the care that they need. So I thank you for your time.
Thank you, Vice President. I appreciate that. You hit on so many things that I was going to ask about, which would have been, you know, what happens to the staff when we have these shortages? But you clearly articulated that there's additional costs due to overtime, that people burn out because of those additional overtime hours, and, you know, that they also seem to be devalued as they are not being listened to in those settings. So, you know, I mean, I don't mean to say it again, but I think it needs to be said, in that the people that do the work need to be valued, you know. So that's on the staff end, and I think you articulated, and so did some of the other people who have already testified about this. But, you know, as far as individuals go, when we have somebody who's working overtime and we have someone who's burned out, you know, the people that they're serving, you know, can you just kind of speak to some of those challenges, some of the things that happen when the staff has been burned out?
Sure.
And just the opportunities and services that should be or might not be there for those individuals?
So, I mean, realistically, when we diminish our clinical supports, so for example, for nurses, which we are having a very difficult time recruiting and retaining, just like many other places, those nurses often are assigned a group home, 2 group homes, to provide direct support to individuals in their care. When we have staffing shortages, they may have 5 or 7 group homes that are spread out over a large geographic area. A lot of focus is on keeping paperwork up to date with electronic health records. So their time and energy is shifted from doing the actual work of providing services to driving to places to provide services. The frustration on the part of our nurses, medical professionals, is that they're not heard when they bring issues to the attention of management. This isn't working. I'm not seeing the person that is in my care. I need to be able to provide time with family members. I need to train staff. And when they're stretched that thin, those things fall to the wayside. And I will tell you, nurses have, like we all know, a lot of other options. So they're leaving in droves. We can't function without nurses and doctors and all the other treatment professionals that we have in our system. It undermines care. And I think, you know, when you talk about burnout, the work-life balance issue is huge. We have people who go into work, and a lot of times these are our rehabilitation specialists who have been redeployed into other settings because of staffing shortages in our DSP lines. those folks go in and they're not sure when they're going to get to go home. They don't always know the routine of the house. They are thrown into situations that they haven't been trained on, where they don't have time, as BJ said, they don't have time to read somebody's, charts. They don't know the person. So I think just like with DSPs, when they're spread so thin and when they're sent to different locations, you are not able to provide the continuity of services and build relationships. Most of us in this field really care about what we do and the relationships we have, and that's what makes our work successful and rewarding. And when you're going from place to place and have quadruple the amount of people you're trying to provide service to, that just goes to the wayside.
Yes. And along those lines, as we went through, the throes of the pandemic, and we're not in a super place now due to those staff shortages, and I think I've heard you before, and I hear this correctly, that many individuals had to cover for those staff shortages, had to go into multiple homes that they typically didn't work in, and therefore, put their own health and their family's health at risk. Can you just speak a little bit to that?
Yeah, absolutely. I think one of the things that happened is people were redeployed to cover for the shortages. And because of those redeployments, there were transmission risks that went with that. So you take somebody who works in one house with a certain group of staff and a certain group of people, and you move them into a completely different cohort group, and then they go from one place to the next place to the next place. And so that increased spread. One of the things that we heard a lot was frustration around the lack of available quarantine leave, the lack of support for their people who work for the state, whose children were not in school, no opportunities to be able to take leave without getting in trouble. And it's a real catch-22. You got your family situation here where you have a kid at home, but you need to go to work and there's no option for balancing that out. So there was a lot of increased risks associated with people being redeployed. And I think for many of our members, the frustration level just got too high. We've seen people who worked for the state for 20 years, 25 years leave before they hit their 30-year mark, which for those in the state system know that's very unheard of. We've seen people who've worked for the state for a very short period, they go into a setting and they're like, I'm not doing this, because they didn't get properly trained. And you're throwing people into crisis. Yeah. So, look, we used to have 10 weeks of training for new employees before they went into house. It's like down to 2 weeks and they're out. Yeah. So I think you have a workforce issue that was created, but that means it also can be solved. And there's many things we used to do. I have to say, somebody said to me, we used to partner with nursing schools. They were right on our campuses where we worked with the schools to recruit and develop programs so that when they finished school, they'd come work for us. There were things we did to recruit people into this field, and all of those things have gone away. And we need to think about why that is and why we're not valuing the work that people do and bringing them back into this field, because as we heard today, the numbers of people with disabilities is not diminishing. The service needs are not shrinking. They're actually growing. And the needs for people with children with autism is exponentially larger as we learn more and more people are diagnosed. We do not have a service system that accommodates all the different people that have disabilities. There's not a one-size-fits-all. There can never be a one-size-fits-all. And this staffing situation has led to a service system that is not fulfilling its responsibility or mission. And frankly, as a 25-year employee of OPWDD, I'm ashamed of my agency. I feel heartbroken by what I've seen. And I know many of my members feel the same way because I've talked to them. And I also know many parents feel the same way because I've talked to them. And I know you all know this because you're up there and you're listening to us. So I thank you for that.
Yep, thank you. Thank you for the history and the perspective tied to that history. Senator Martucci?
Thanks, Chairman. So just one quick question, and so of all the things that you said, sort of what strikes me the most and what I'm looking at here is there's been a more than a 20% reduction in the total census when you talk about the placements on your page 4 here, and the suspension of services that you see across this state. And I guess really what's most shocking to me is that OPW is saying that they're not keeping this data past 2019. Can you share with me what that logic's been or why that's the case?
I can't speak to why OPW is refusing to share the data. I can tell you that we had to foil the data because they wouldn't give it to us at the labor management table. We had been asking for it repeatedly and we weren't getting it. So we foiled it, and after we foiled it and we started sharing it with people, they all of a sudden stopped tracking it. So I don't know what to tell you if that's accurate or not, but that's what we were told. So the data we have is only up to that point because they have told us they've stopped keeping it. You can form your own opinion about that. The reality is, when you look at the data, placement availabilities, it goes in 2012, there were 12,002 total capacity for programs. So those are like beds available. If you fast forward to 2019, that goes down to 8,863, which is a pretty significant reduction in the numbers of people that we are serving. And what it also doesn't speak to is that the waiting list for services has not gone down. Now, OPW has framed it differently, that some are not urgent and some have been waiting and don't need services for several years. But in 2018, according to the FOIL we did, there were 10,936 requests for placement. Out of that number, 3,700 was needed as soon as possible. We are not meeting those needs because we've closed almost 5,000 beds.
Right, we're not even
in a
remotely
few years.
close.
So the numbers just don't add up. It's really quite shocking.
Well, thank you for that important data, and I would tell you that I couldn't agree more that those numbers are not even remotely close.
Yeah.
To one another. Thank you.
Thank you. Senator Mayer?
Thank you very much. I have two questions. One on the use of contract and agency nurses, which you highlight in your testimony on page 3. Do you know or have you been provided information about how much they're paying per hour to agency or contract nurses?
It does vary agency by agency, but we do know that when they use agency nurses, the expectations are not the same as for the nurses in our hire. They don't have a caseload assignment. They are often floated, so they never get to know the homes. And we believe I'd have to look at the contracts, but they do get paid more on an hourly basis. I don't know with benefits and all of that. The bottom line is, I think that in many cases, the people who are staffing these homes and our nurses are relieved when they get a contract nurse in, because they're not getting mandated, they're not, stretched so thin. But at the end of the day, that is not the solution to bring in temporary workers that never build the relationships I spoke to earlier about, that never really get to know the staff and the homes. It's a Band-Aid. Just like it's a Band-Aid, to do a one-time payment. These situations are going to help in the short term, but they are not addressing the longer term issues, and they're not addressing the lack of competitiveness that New York State has as an employer. I mean, in the healthcare professional line, pretty much across the board, maybe with the exception of social workers who are underpaid, and I am one, so I'm speaking from experience, most of our folks the pay has not kept up with the private sector. So nurses can make money elsewhere, much more. Physical therapists who now require doctoral degrees can go elsewhere. That leaves people in our care in a lurch. They're not getting what they need if we can't keep professional medical staff. So,
Just briefly, I had asked the question of the commissioner of the number of individuals staffed in OPWDD providing of care who either got COVID or died, and you provide the information here. And you say as of November 2020, pre-vaccine, 572 clients and 1,190 staff, and there were 53 deaths of clients in OPWDD facilities, according to your data, by November 2020. And I don't know if that's a cumulative number, 1711 under that, Or is that just a number for April 2021? Is that a total
So
number?
that's a total number, so it includes the 572, but I must point out, these are only on the state-operated side. This does
Correct.
not include the voluntary private providers, because that number is exponentially higher.
Yes, and that number is on their website, even though the commissioner said it didn't have it, but, so 1,711 clients of OPWDD died during this pandemic.
Were infected,
Oh,
105.
excuse me, 105 died, you're correct, and 1,711 were infected, and 9, you don't have data after December 2020?
They stopped giving it to us. So we had initially been getting data about employees passing away, and we did have several in OPW. The last number that they gave us was 9 employee deaths in December of 2020, and after that point, they would not give us that number and wouldn't confirm whether that number was accurate, went up, went down. You know, at a couple of those cases, they weren't sure because they didn't have the death certificates. There were some benefit issues, but by and large, that was the number they had given us up to that point.
Thank you.
Senator Serino?
Thank you so much for your testimony today. I can tell you have a real passion for taking care of people, and it's so important. I have a question, because I know Dr. Kastner was asked how many people were awaiting services, and he didn't have an answer. And you were just addressing that. You said the waiting list, and I missed where you said your waiting list came from. Your information, you had almost 11,000 people.
Yeah, so our FOIL covered the years of 2012 to 2018. And in 2018, the total request for placement was 10,936, with 3,700 of them needing it immediately. Since that time, we've been asking for updates on that, and they have not provided them.
Okay, and I know a lot of this information is in here, but for the public that's watching this, I think it's important, you know, what you just told us. And the other question I have, you talked about recruitment, and you were talking about the partnerships that you used to have. So why did they go away?
You know, I've worked for the state for 25 years, and I've watched really good programs and support services dissipate over the years with really no explanation. I can't say why, other than the state has abdicated its responsibility in recruiting and retaining a professional workforce. They have not put forth the funding, the resources, and the efforts to ensure that we have relationships with colleges, that we are doing everything in our power to recruit and retain people. You know, from increased pay and working with civil service on looking at the pay scale. The pay scale for our nurses has not been looked at since 1983, okay? 1983. And when you think about the nursing shortages, we're in a deep hole. And I don't know why they haven't addressed these things, but it's not for our lack of trying, because we bring it up on a regular basis, and we're happy to partner with them. We have some really dynamic members who would be happy to work, on subcommittees and task force and be liaisons with colleges, and nurse administrators who can build rapport with nursing schools, and they haven't taken us up on those offers. So, they've said they would, but that really has not happened. I will say, we did just get a geographic pay increase. That was for all nursing titles across all state agencies, but frankly, while we appreciate that, it's a Band-Aid. Some places didn't get any increase because they were already getting a geo increase. And for those that aren't familiar with that, that's where civil service gives a little bit of a bump in salary because they can't hire people. So, the agency has to be willing to do it. And in this case, because of how dire it was, they were. So we did see a little bit of relief for some of our nursing staff and some nursing titles about 2 weeks ago. So that's a positive.
It just seems like those partnerships make so much sense. Have you met with the governor yet? I know she just took over, or had any conversations yet, or plan to?
We definitely plan to. I think, we didn't want to be calling her up on day one with our laundry list. So we're making sure that we're giving her time to get her feet wet and understand the issues. But we certainly believe Governor Hochul is an ally, someone who cares about people with disabilities, someone who's willing to listen, and we will absolutely be reaching out to her on not just this issue, but a number of issues around the executive agencies and her management of them moving forward.
Great. Well, thank you very much.
Thank you.
Thank you, Vice President D'Antonio. Thank you for your commitment to your members and the people they serve. We appreciate it.
Thank you, thank you.
Next up is, next witness is Leslie Feinberg, founder of Supporting Our Youth and Adults Network. And on deck will be Joseph Macbeth.
Hello. Wow, nice to meet you. Nice to see you, Senator Brooks.
Good to see you.
Yeah, a little different than being in Massapequa together. So, good morning, and thank you so much for shining a light on this really huge crisis that's affecting the OPWD system. And if something isn't done soon, it's going to be the collapse of the OPWD system. For those of you who don't know, Supporting Our Youth and Adult Network is a network of families and self-advocates on the journey of self-direction, and with full budget authority, so we need to be clear about that. We have hundreds of subscribers to our email lists, and we meet virtually to support families monthly. So direct support professionals, or we like to say staff, provide community rehabilitation support. Given the dramatic differences among participants and their varying demands in their communities, staff are required to be savvy to individuals' capabilities and their communication style. The role played by staff reflects OPWD's commitment to the Olmstead decision and full community integration and participation for people with IDD. Since COVID, we've been hearing self-direction participants say that they have no escape valve for fear and anxiety because all the positive outlets they had dried up because they don't have staff to help them get out into the community. Therapists and psychiatrists are booked solid. And there's just so much we as primary caregivers can do. We're all suffering from the increased emotional upheaval from living through a pandemic. We're all doing the best we can with the limited resources we now have. But let me tell you about a story about one self-direction participant and what the lack of staff means. So this young lady had a bunch of friends that she met in day program years ago who she kept into contact with. She's in self-direction now. And she lost 2 of these young ladies. It's pretty bad. And then when things got really bad with the pandemic, caregivers, families said, look, we can't have staff coming to the house anymore. So now she lost the camaraderie and trusted staff. And what did that mean? Well, many trips to the emergency room, medication changes, and increased vigilance from everyone in the family because of increased suicidal ideation. This is serious. So you asked, what is the cause, Senator Mannion? And as you've heard from everyone else, there's so many causes, but really the primary cause, I think, is that the staff in general, DSPs, staff, whatever you want to call them, are not valued, period. And so on the one hand, they're deemed essential, but on the other hand, their pay structure has remained flat for so long. There's a perception that this job is simple. It's not. Direct support staff for the self-direction community provide one-to-one support that requires them to be intuitive, self-starters, executive function coaches, calm in the face of unexpected changes to routines, and most importantly, dedicated supporters for the people who hire them. Relationships between staff and participant are the most important piece of self-direction, but the OPWD system has not yet created a process to reward loyalty or employment longevity. The retainer payment initiative at the beginning of COVID allowed employers an opportunity to pay some staff due to the closure of day programs, but it was based upon an ambiguous definition of being directly affected by COVID that created some confusing guidelines, and the self-direction participants could not access this initiative and lost the ability to pay a retainer payment to some of their staff in the beginning. It just disappeared. It was confusing and convoluted and just didn't work. Caregivers and participants' access to the community ability to network has also dried up. No surprise there. But we can't find candidates to fill our staffing needs. Before COVID, I worked with the Nassau County Office of Mental Health, and they supported our efforts to hold a job fair. And we connected with local universities and graduate school programs, but it was very difficult. And our job fair attracted 10 times more families than candidates. We need some help. So considering all that staff do, now is the time to create a pathway for increasing the OPWD billable rate to a living wage for all, and validate the essential status of all DSPs with some sort of reward or bonus for doing an essential job during the pandemic. Yes, I know it's a Band-Aid, but you know what? There are folks that really worked hard, and something is better than nothing. And increase public awareness. We've heard a few people speak already about programs that were a long time ago that worked with nursing schools and things, and the ability for the state to do public service announcements. We need to redo that. We need to look at that. We're missing out. And there needs to be some easy access for information and qualifications and training and career opportunities that are mindful of all the different service delivery models. And within the self-direction model, we need to establish industry standards for competitive employee benefits for all self-direction's fiscal intermediaries. Because otherwise, what happens is staff want to only work with one particular FI because they get a better benefit, but that FI isn't taking on people. So there you go. They don't want to work. You need to increase collaboration among the FIs and support brokers and individuals and their circles of support and staff with initiatives related to training and management. And in that scenario, we want to make sure that OPW doesn't stick in another entity to oversee it all. But we want some training. We want some access to training and management techniques and procedures that will elevate the efficiency of circles of support and fiscal intermediaries. And we need to remove the onboarding barriers to allow staff to be easily employed by more than one employer at the same time. The time is now to validate and value the critical work of our DSPs, our essential workers. It's essential that OPWD's hourly rate for DSPs must be increased. State funding in the next budget cycle must support the rate increase so that any gains in salaries or incentives made with FMAP funds are not lost or have to be maintained at the expense of cutting services. So I request the opportunity to continue dialogue with the committee and with OPWDD and other policymakers before any guidelines or regulations or HCBS waiver amendments addressing the solutions to the workforce issue are put into stone. And thank you.
Thank you for your advocacy and your testimony and for helping bring a collective voice from your families and the self-advocates to here today. Going down the road of the fiscal intermediaries or support brokers, about how long does it take for that approval process, if you know?
So you mean from the beginning of OPWDD eligibility until they get approved for self-direction and then the budget is launched?
I think what I'm looking for is when they actually can be designated as a fiscal intermediary or broker from when they start the application process.
So
Or either.
you're talking about from the participant's perspective, correct?
Yes.
Okay. So what I've been hearing in the grapevine is that it's taking about a year for OPWD eligibility and to get approved for self-direction. And then at that point, you need to find an FI, you need to find a support broker who finds the FI. That's where we're running into trouble. There aren't enough support brokers to go around. There aren't enough support brokers that are well-versed, that people are looking for.
Mm-hmm.
There are people who take their support broker training very seriously and take additional classes, not just the minimum. And those are the support brokers that people are looking for, but they're hard to find. Their caseloads are filled. So there are people in Soyan that I've spoken to that it's taken 2.5 years, and they just launched.
Yeah.
Like,
And that's what I was going for, but I didn't really articulate it clearly. So can you just speak to if someone wants to become a support broker, what that process looks like?
so there's lots of trainings. It was all done regionally by each DDRO, and there's trainings. And other than that, I really don't know. I'm not a support broker, but you can certainly, I'll get people, we'll have a conversation with the support brokers who you met on our Zoom call.
Sure.
they can explain that whole thing to you. I don't really know.
Yeah, thank you. I really appreciate you letting me go down that road. Thanks.
Leslie, it's good to see you, and I appreciate everything you do in the district. We've talked many times. and,
Thank you. Thank you.
Your heart is in this in the biggest way, so thank you very much.
Thank you.
I
Thank you.
appreciate it. Yep. Thank you. Our next witness is Joseph Macbeth, President of the National Alliance for Direct Support Professionals. And next up after him would be Michael Bolton.
I'm going to probably go off script a little bit here. First thing is, save your money on marketing campaigns. The best recruitment strategy that you can have is a living wage. Pay a living wage, people will come.
Yeah.
All right? Senator Mannion, Ranking Senator Martucci, members of the Standing Committee on Disabilities, thanks for inviting me here today. My name is Joe Macbeth. I'm the founding president and chief executive officer for the National Alliance for Direct Support Professionals, the NADSP. For nearly 40 years, I have either provided direct support, studied and researched the direct support workforce, or advocated on their behalf. Prior to the pandemic, I spent more than a decade traveling across North America, engaging with tens of thousands of direct support professionals each year, promising them to make sure that their voices are heard by decision makers like you. I take this opportunity to speak with you today very seriously. The NADSP was founded in 1996 by the late John F. Kennedy Jr. Many people do not know that John's contribution to the rich Kennedy family legacy to disability issues was the creation of this advocacy work that we do at NADSP. And in 1996, he wrote, "Quality is defined at the point of interaction. Quality is defined at the point of interaction between a staff person and a person with a disability." I think Mr. Stasio talked about that very, very clearly. When I think about that statement, I think all across the state of New York, all across the country, people with disabilities are achieving meaningful things, not by magic, but by a skilled, ethical professional. And that means a lot. Sadly, for decades, we've relied on this revolving door of strangers, supporting strangers. Nobody is prepared to be a direct support professional on day one. I started in 1982. It took me at least a year to understand what my job was, but also how to support people and to develop those rich professional relationships that are required. Money alone is not going to fix this decades-long systemic failure. It is a systemic failure. It's bordering on systemic exploitation of this workforce. It will require a myriad of strategies that begin with a living wage for new workers and career ladder opportunities to those who commit to this as a long-term career, so they can earn higher wages as they objectively demonstrate advanced skills and ethics. And with all due respect to the commissioner, what he described was not a career ladder at all. He's describing a pathway out of direct support. We've got tens of thousands of direct support professionals working today, right now, who've been doing this for years. We need to give them opportunities to stay in the jobs that they are good at, jobs that they excel at, and pay them according to their skills. That's how you're going, that's a retention measure. Recruitment is easy. Retention is hard. And by the way, I also don't think that we should forget about the hardworking frontline supervisors and investing in their skills. A lot of direct support professionals leave their jobs because of poor supervision. A lot of frontline supervisors that work in IDD are promoted because of their direct support skills, not because of their supervisory skills. completely different skill set. We need to build their supervisory skills. And I'm also not going to let the providers off the hook either. We need to help create healthy workplace cultures, a culture that really values the direct support. We also need to improve their business acumen to assure that person-centered services are delivered, and we expect a high degree of professionalism across all levels of the organization. You know, community living was built on the backs of the direct support workforce 45, 50 years ago. We closed institutions, not only in New York, but in every state in this country, with the promise that we could do it better and cheaper. We do it cheaper by paying direct support professionals poverty level wages. It's time to fix, it's time for the system to pay up. Now, in closing, COVID-19 has merely lifted the veil on something that we've known for decades. The failure to support the direct support workforce, our most important human resource in this service sector. People with disabilities don't need heroes. In fact, I believe by calling direct support professionals heroes, devalue people with disabilities. People with disabilities expect nothing more than a competent, highly skilled, ethical professional to support them with their physical and emotional needs. Lastly, the rest of the country is waiting for New York to lead. Once again, the rest of the country is looking to you to lead. If there's a silver lining here in this wretched pandemic, it might be that finally our direct support workforce is getting the attention at the highest levels of government. We're going to have a once-in-a-generation opportunity with an influx of money. Don't squander it. Don't squander it. Invest. If we don't, we're just going to perpetuate this decades-long failure. Thanks for the opportunity.
Thank you, Mr. Macbeth, for the information, the perspective. Who can we learn from in New York? I know we want to lead. What state is out there that's doing it right, if I can ask, because you get to get a taste of all of it. Is there anybody in particular?
There's pockets of excellence in every state. There's pockets of excellence here, right? There's organizations that are finding ways to make it work with existing budgets. They are putting their resources where it really matters. And they shouldn't have to do that. It should come from a funding stream to support best practices, not an organization who really values their direct support professionals to finding a way and raising money or having golf outings to pay for their direct support professionals. That's disrespectful. And you can look at Canada, for example. We do a lot of work in Canada, Senator. And Canadian direct support professionals earn a living wage, and they have the same turnover problems that we do have in the States. Why is that? They're devalued, they're not supported well, they're not respected, and they work in toxic workplace cultures.
Thank you for that. I appreciate that. No.
I tend to overwhelm people. It's okay.
You mentioned, and I think Leslie had also, and you had alluded to it, the flexibility that's necessary for DSPs to be able to move between agencies. Are there other places that do it better than us?
So it's hard for a DSP to move. Well, I mean, it's not hard to find another direct support job. Here's the issue. Here's a career ladder that would work. A career ladder that builds on a direct support professional's knowledge, their training, skills, taking that training and applying it on the job in the form of skills and values, right? And building those career ladders around knowledge, skills, and values from an objective third party. And by the way, I submitted a report that we gave to the Administration on Community Living, ACL, about a very innovative career ladder program that we created called the eBadge Academy. It's a digital eBadge credentialing program that uses knowledge, skills, and values. So a direct support professional who earns a certification through us can leave that job and go to another job, and that employer can hire with confidence. That's what every other profession has, a certificate or a credential or a license to practice. Here, you could be a direct support professional in Buffalo, move to Albany after 10 years of working, and we'll hire you, but we're going to train you all over again like it's your first day on the job. That's not only disrespectful, but that's a waste of money. Career ladders.
Yep.
Keeping good DSPs in their jobs.
Thank you for that. That's very helpful. I appreciate that perspective, and thank you for everything you do.
Thank you.
Next up is Michael Bolton, steering committee from NYC Fair, and on deck is Fran Turner.
Good afternoon, Senator Mannion, New York State legislators, direct support professionals, self-advocates, families, and other advocates of the IDD community. Today, I am representing New York City Family Advocacy Information Resource, or as we are known, New York City Fair. On behalf of my New York City Fair colleagues, I'd like to thank you for including us as part of this hearing on the urgent need to fix the inadequate and inequitable wages paid to the essential workforce for people with IDD, direct support professionals, or DSPs. Randy, my wife, and I have a unique perspective on this crisis. We were both DSPs back in the day. We know exactly what the job and responsibilities of a DSP are. I started as one in 1978, and Randy did in 1973. We met in 1980 on the grounds of the Willowbrook State School. We were both students pursuing master's degrees in the field of developmental disabilities and therapeutic recreation. It was well before we got married, and ironically, we are now the parents of Justin, who has multiple disabilities and is himself dependent on the care and expertise of DSPs. We know being a DSP entails everything from taking people to doctors, medication administration, personal care, sometimes G-tube feeding, as well as making sure individuals' lives include personal choice and social experiences. DSPs are the ones who are there to assist the more independent or do much more for others less capable. Unfortunately, their compensation does not come close to reflecting the level of responsibility and accountability they are saddled with, including the specter of an unwarranted Justice Center investigation. And unlike when I was a DSP and earned almost double minimum wage, they are asked to do it for minimum wage. When I started in 1978, the New York state and federal minimum wage was $2.65 an hour. Yet with only a bachelor's degree and zero experience, United Cerebral Palsy Associations hired me to be a DSP at $5 an hour, close to double the minimum wage. Clearly, it was a different moment in time. Society valued helping people and supported the workforce that did this work, dealing directly with and fulfilling the needs of individuals with developmental disabilities. What happened during the past 40+ years? Now society and government no longer value this critical job, or they'd pay them accordingly. Why have these caring employees become minimum wage workers when in actuality they have people's lives in their hands? Why are people who stock shelves or flip hamburgers making more money? By no means am I demeaning these jobs, but so much less is asked of them. Additionally, these companies can raise prices to cover the rise in the minimum wage. IDD providers are dependent on government funding and have no other means to pay more than meet the increased costs. When the people who are tasked with taking care of the needs and lives of individuals with IDD, a job with many more responsibilities, but are getting paid so poorly, that shows there is something clearly wrong with the moral compass of our society, and is an indictment of those in government whose sworn oath and obligation it is to protect their most vulnerable citizens. When government sees the need to raise the minimum wage for industries like fast food workers and those stocking shelves, they need to understand that one unintended consequence is that it devalues DSP's work when their wages are not raised to be well above minimum wage, given what we ask them to do. It is simply unconscionable to not adequately compensate employees whose very core responsibilities are people's lives. It is now incumbent on legislators like you and government as a whole to seize the moment and realize your responsibility to correct the inequity in DSP compensation and pay them properly for all they do. Thank you.
Thank you, Michael. Thank you for your work, and thank you for your advocacy and your of course, perspective as a parent as well. Was there a recruitment and retention crisis, if you recall, in the late 70s and early 80s?
Not at all. It was a very, as I said, it was a different moment in time, and people flocked to the field also because, as I said, I had no experience. I got paid almost double the minimum wage. So that would be kind of like offering a DSP $25, $27 an hour. You'd think they wouldn't come in flocks and droves. And I did it actually for extra money. I was working for the then Board of Education in New York and delivering for a pharmacy, and I wanted more money. And like one of my best friends said, "Oh, this agency, United Cerebral Palsy of New York State, is hiring people paying $5 an hour." I said, $5 an hour? Boy, could I use that money. So no, there was no problem getting people.
And over the course of your tenure as a DSP, as it approached, several years down the road, did you start to see that recruitment and retention crisis beginning?
No, because I did it for several years, and as I said in my testimony, my wife and I were pursuing master's degrees, which I got, so I, was able to get promotions, et cetera. So I wasn't a DSP, but to be honest, I hired DSPs regularly, and I never had a problem. I got college students who wanted experience so that when they got their degree, they could get other jobs. I had relationships with colleges in New York City that sent students that we were actually volunteers, didn't get paid a dime, but when they did a good job, I would offer them a job, and then they would take it. So this recruitment issue didn't exist in the 80s, probably not even the 90s. We hit 2000, and then it started to slowly, and now it's like an avalanche going down the mountain.
I just have one question. Thank you, and you highlighted in your testimony that the increase in the wage for fast food and other workers the state did really had a significant impact. But is it your opinion that that was the dispositive fact that led to the inability to hire enough DSPs, or are there other factors that contributed?
I think there are a lot, but that certainly was a major factor because what we're asking DSPs to do, the amount of training and then the responsibilities and the paperwork, and if you can make the same or actually more money, I hate to say it, going into McDonald's, and when you start at 9, you leave at 5, that's it. You don't have the specter of other things hanging over your head, or all the issues and the care, and then you have to have a caring heart to want to be a DSP, and I'm not demeaning those other jobs, but I don't think you have to care as much to stock a shelf or work in a McDonald's.
Very hard job.
We need to treat these people with the respect that they truly deserve.
Thank you. Thank you.
We agree. Thank you, Mr. Bolton. It's great to see you today, and I
Thank you very much.
appreciate everything you do.
Thank you.
Next up is our next witness is, yes, Fran Turner, Director of Legislative and Political Action from the Civil Service Employees Association, and after that will be Jeff Patterson.
Hello, how are you? Good to see you again.
Good to see you.
Nice to see you, Senator. I don't want to be repetitive, so I'm really going to go off script. But I have to tell you that as we were doing this testimony and thinking about this hearing, that we are very frustrated. CSEA is very frustrated. Our members are. They're angry because this recruitment and retention problem didn't just appear. It's been going on for over 20 years. And ever since I came to CSEA, every time we testify at budget hearings, or MH hearings. We talk about the short staffing that has been going on for years. Now we've reached a crisis, and I hope that we're going to actually take care of it, because we cannot give our members more hope that we're going to fix this, and yet there's still mandated overtime, not going home at the end of their shifts, not having a work-life, home-life balance, not being able to attend functions, school functions, pick up their kids. They go to work and they never know when they're going to come out, right? You know, back in 2016, CSEA actually negotiated in our contract that any worker that was mandated over 16 hours in one day, because it happens all the time, is entitled to double time. That should have been a real wake-up call to all of us, that there's something wrong when we are mandating the workers over 16 hours a day. And obviously during COVID, we all know it got worse. And we all know that these jobs are undervalued and undercompensated, and our members are tired. We're seeing attritions at higher rates in this industry than we ever had before. They're burnt. They can't do it anymore. But this recruitment and retention, it didn't happen overnight. It has been going on, and we have been begging the state and the legislature every year, you need resources into this agency. Bottom line, you need resources. And while it's wonderful that we're gonna get this FMAP money, it is a one-shot. And you know what? I heard you, Senator, in your opening remarks about committing another $500 million. But I would only say to all of you, that commitment has to be over several years. Don't commit for 1 year and then we go backwards, because unfortunately I've been around and I've seen that happen, right? We build up a few of the services and then the next year we take them back. That is the worst thing we can do. There needs to be a real investment in OPWDD that we haven't seen in years. As far as retention goes, you know, it's hard when the new person coming into work is the first person mandated when you can't get enough volunteers, right? They don't know what they're in for. They have children to pick up after school. If they don't have childcare or family in the area, it's a problem for them. In upstate New York, I will tell you, we don't have a subway system. Transportation can be a problem. We need to look bigger than just the compensation and so on. We need to look at other things that are stopping people from taking these jobs, because they can be good jobs if the state is committed to continuing to fund them and to reward them for the difficult jobs they do. So I'd like to be optimistic that we're going to get through this, that we're actually going to see an influx of employees in this area. I will tell you, and I will commend OPWDD. We have worked with them for 3 years. We have partnered with them. We have done job fairs with them. We've done boot camps where we go all over the state trying to recruit. We have our members trying to recruit their family members, especially someone who's made a career out of it, right? And we have worked on this compensation package that I heard the commissioner talk about for 3 years. I will say to you that there's other agencies that need to be looked at. Civil service is one. We don't do a good job marketing. We don't do a good job providing these tests on a regular basis. Obviously, COVID slowed us down, but there's more work to be done to recruit these members. As far as retention, look, I'm reading about Walmart and Amazon offering college. What's the state doing? We should be the leader. But you know what? Then I sit back and think, well, when do you want them to go to college or take even a course online if they're working 2 and 3 shifts? They have no time to do it. We do have negotiated funds. It's called the partnership. And most of our members in OPWDD do try to take courses, but there's no time anymore because they're working, they go home, they do have families. There's no time. But why isn't the state leading in education and free education to try to recruit and retain these workers? When I saw that Walmart and Amazon was, I have to tell you, I was taken aback by that. I'm not sure what colleges they're using or how they're doing it, but I was taken aback by that because the state should be the leader in recruiting and retention and offering incentives to keep people there. I would also comment on one other thing. You know, it used to be these state jobs were where people wanted to be. They provided good benefits. They provided a defined benefit contribution. But every year, it costs our members more to maintain those benefits because our members do pay and contribute to their health care. They're paying more for their pensions now with less of a benefit under Tier 6. It has definitely affected recruitment and retention of workers. Plus, instead of being like the private sector with a 5-year vest, we have a 10-year vest. So if you want them to make a career there, you've got to give them steps along the way to make them stay, right? And they've got to feel valued. They're very undervalued. So I'm hopeful, and I would only stress, it can't be a 1-year commitment. It has to be a multi-year commitment to re-establish this agency and to provide the clients with the services they need, because they're suffering as well. I heard some of the previous speakers talk about they can't go out. There's no time to take them out to the park or to do anything recreational with them. That's not fair to them. The day have programs, they're broke. They're not up and running because we can't put the staff into the day have programs because we need them in the facilities. And one thing that I would point out too, the state workforce, and we do represent private sector, the state workforce has the more difficult client, right? That is, and it is a hard, stressful job, very hard. So I only hope that we can go forward and actually look at this and look at what needs to be done and commit on a long-term basis.
I agree. Thank you, Director Turner. I appreciate that. I stand with you when it comes to the changes that have occurred in the retirement system and the fact that things do not happen in a vacuum. And young people can look to the future and look at what opportunities are there and make decisions based on that. And I'm afraid there are some repercussions because of those changes. So I stand with you on that. One quick question would be, if one of your members refuses mandatory overtime, what could be the repercussions of that for them?
They would be brought up at a notice of discipline, and then it would go through the process. We have a triage process on the state side. So it would go to an arbitrator. It would eventually work its way up. I will say this about our workers. They are the best, and they are committed. So they stay there because it's not like you can really refuse it. If you're in a home and there's nobody there to relieve you, they are not going to leave those clients. They just wouldn't do that. So there's not a question on them refusing the mandated overtime. I will tell you this, as I was sitting here, I got an email or a text from my colleagues back in the office that they're now being denied time off because there's not enough workers, right? I mean, vacations were hard this summer, and that's bad. So in order to get a day off, you know what they'll do? They'll have to call in sick. They'll have to call in sick. And I mean, how do we manage the workforce like that?
And if you had to speculate, compared to 10 years ago, and it's going to be an awful question because you can use any data point that you want, but what has happened to the frequency of mandated overtime over the course of those 10 years? You know, if you just sort of, whether it's quantitative or qualitative.
You know what, it has gone up. Every year we've testified to this, right? Every year you can see our reports, and you can look at Tom DiNapoli's does an overtime report all the time. Every year it has gone up because as the workforce shrinks, and look at, we're missing a lot of full-time jobs, right? We are at our bare minimum right now. Sometimes it amazes me how our members ever got through the worst part of COVID with the least amount of workers they've ever had, right? Because we had people out sick. We unfortunately lost lives, and it just made it worse. So the mandation is big. It is a problem. We certainly understand that everybody is trying to recruit, and we are working with them to try to recruit, but it's a problem. It's a problem. And you know, if you want young people to come in, and we do want people to make a career here, there does need to be a career ladder. But if you want young people to come in and they have families, they can't work these jobs. You can't go to work and not come home for dinner or not be able to pick up your child or go to a school function. It doesn't work. So that's when they leave after maybe 18 months. They're out of there if they can find another job. And I do agree, while minimum wage and increasing minimum wage is the right thing to do, it has hurt as far as our recruitment efforts and our retention efforts especially, because people will go to an easier job where they know the schedule, where they can spend time with their family, have a vacation, before they will stay in state service or direct care service. And you know, another part of the problem with direct care service is we are all competing for a small field, whether it's personal care, whether it's taking care of the elderly so that we keep them out of the nursing homes, whether it's staff for nursing homes and hospitals. We're all competing out of that same pool, and there's not enough of them, right? So you see the incentives. I mean, our hospitals in Syracuse were offering nurses $10,000 boning sinuses. Never heard of before. But the competition for these workers, and I agree, you have to have heart to do this job. The competition is tough. And if the state can't keep up, we're gonna lose more and more.
And that's why people are using the word break. It could break.
Yeah.
Just break in.
It's frustrating. It's frustrating. It really is. And I've seen it over the years, decline. And it makes you angry, right? Because it didn't have to be this way.
Yeah, thank you, Chairman, and thank you for your testimony. I mean, what's clear to me today, and I think it was clear coming in here, but even more clear, is that we're not at a crossroads right now. We are at the edge of a cliff in terms of this issue and in terms of what we face. And I look at your report here and to see that we have 1,000 unfilled positions. You know, the average person worked 6 full weeks of overtime. I mean, when you really start to think about these things, it's unbelievable. And that 18% of overtime payments are coming from OPWs. So I just want to let you know that certainly this data and all the conversations we've had today haven't been lost on me, because you know, in so many ways, as you said, this is a problem that's been a long time coming, and now we're far behind the 8 ball. So we have to take drastic action to catch up. Otherwise, as the chairman said, this system can and certainly will break.
Thank you, Senator.
Thank you, Fran. Great to see you. And
You as well. Finally.
yes, we fought a lot of battles together. One thing I saw during COVID in group home settings was when an employee, and I think in the voluntary and in the state system, when there was a case of COVID in the group home, then the worker was forced to quarantine by living in the group home for the full quarantine period, which you remember was quite long. So the worker I knew had a 5-year-old at home who she had to leave with the husband for like 2 weeks and live at the group home, and until the quarantine period was over. So the additional pressures on these employees, your members, and all who do this work during COVID made it a job even harder to do. And credit to your members for, like you say, doing it with heart and sticking in there and not denying mandatory overtime because they see someone needs the care. But I agree with my colleagues. We are at really a point of no return here. And I hope when we get ready for the budget, in conjunction with your point, this can't be a one-shot, you come with the proposals for how to ensure that in terms of pension changes, benefit changes, incentives, the things you mentioned, that you provide us with some of the things you think will be helpful. Obviously, we can't always get them all, but hopefully with this governor, we'll have a better chance. But I just look forward to hearing the specifics you put on the table.
We do have some specifics for you. We didn't want to get into them today, but yeah, there are specifics. And you're right too, Senator, because a lot of our members had to sleep at the homes, right? Not just because of COVID, but because there was no staff to relieve them as well. So they were working 24/7 shifts. I mean, they're not going to leave the clients.
Thank you.
It's so great to see you, Fran.
You as well, Senator.
And as always, you are spot on. You know, I think about, I was a single mom for years. I can't imagine how some of your single parents are doing this with these double shifts. And we talk about health and mental health.
Yeah.
You know, it's so bad for them. When I was younger too, I thought about this with these double shifts. I worked a double shift and I ended up having a car accident. I fell asleep behind the wheel. Luckily, I wasn't hurt and no one else was hurt. But those are real life circumstances that can happen. And once in a while to do a double shift is okay, but to
Right.
have it mandated because of the lack of people is something that we need to address immediately. So, but thank you very much for your testimony.
You're welcome.
We get it.
I get it.
Thanks.
Thank you. Thank you for everything you do for your members
Thank you.
and the people they serve. Our next witness is Jeff Patterson, Government Affairs for Developmental Disabilities Alliance of Western New York, and following Jeff will be Michael Searock. Sorry about that. I appreciate everybody's patience too. We know we're going long here, but I hope that our determination and grit will not fall on deaf ears in the next few months.
Good afternoon. Thank you, Senator Mannion, for your leadership. Thank you, Senator Martucci, Senator Serino, and your colleagues for your time and your advocacy. I'm Jeff Patterson. I'm the Chief Executive Officer of a provider agency in Niagara County, and I'm testifying today on behalf of the Developmental Disabilities Alliance of Western New York. Donnie represents 40 not-for-profit providers from Buffalo down to the Southern Tier and over to the Finger Lakes. I've submitted written testimony with a lot of statistics. I'm not going to read all of them, but it does bear mentioning that in the Western region, vacant DSP positions have increased 34.5% over last year, 51.2% over 2019. Our member agencies have 3,000 vacant staff positions right now, and if you calculate that, it represents more than 4 million hours annualized of authorized supports that cannot be delivered. Families taking their loved ones home because 24/7 certified houses don't have enough staff. Parents stuffing flyers in mailboxes trying to find people to be DSPs. Children going without supports, parents going without respite, hoping they can get through another day. People with disabilities who want to work but don't have employment counselors to help them live their best lives. People living in apartments who have to plan what time of day they'll use the bathroom around the spotty schedules of their support staff. DSPs, mostly women and disproportionately women of color, trying to make a decent living and hoping they don't get mandated to cover those multiple shifts that we've heard so much about so they can see their kids and go to their second and third jobs. Managers working the floor and praying their paperwork can wait just a little bit longer before the state surveyor shows up. Exhausted staff working multiple shifts, trying not to make a mistake that the Justice Center will tag them with for the rest of their lives. This is the human toll of poor public policy. And make no mistake, while the pandemic has made it worse, it began long before COVID, as we've established today, and it will not be miraculously resolved whenever the pandemic mercifully ends. We know that DSPs made well above the minimum wage before and now barely make minimum wage. 2.6 billion in cuts and no COLAs over a decade brought us to this point. Budget neutrality that took the steam out of the Be Fair to Direct Care increases that were awarded. And even now, OPWDD is aggressively pushing another residential cut, which is causing providers to hold on to funds that could otherwise be used to support the workforce. And I was astonished to hear the perspective from OPWDD that somehow those cuts would not affect DSPs. Where do they think that those effects will be? How can a $238 million cut not affect the workforce? So thanks to the American Rescue Plan, New York State has more than $500 million. That's great, but that American Rescue Plan was signed into law on March 11th. Those revenues were included in the state budget past April 7th, and we're sitting here on September 14th, and provider agencies still don't know what we're getting or how it can be used. So we've gone into our own thin cash reserves to pay emergency bonuses and raises to keep the system from totally collapsing with no support from the state. And we know that support will come eventually, but it's critical that New York State begin planning now for what happens when the federal funds are gone. We cannot give a temporary bump to DSPs and then shove them off a fiscal cliff in a year or two. And we also know that all of that hinged on one runoff election in another state. And if not for that, those dollars wouldn't have come to New York State at all, which shows us that New York State has to get some skin in this game. Overzealous oversight is also to blame. The Justice Center has effectively criminalized error, and DQI surveyors show very little understanding or empathy of this existential crisis that we're in, or the power dynamics inherent in their work. Their demeanor is often so confrontational and intimidating that DSPs call off so they don't have to be in the presence of these surveyors. Surveyors need a higher standard of effective communication and cultural competence, and we need a top-to-bottom review of regulatory enforcement because we see that New York State has no tools to uplift the workforce, only punitive processes that discourage people from working in the field. We have some information in our testimony about the career ladder, and we certainly agree with all that has been said. I would just point out that if we don't deal with compression, we effectively collapse the career ladder. And the policy of the previous administration was compression doesn't exist. That's not something we're concerned about. We need to be concerned about it. Sometimes providers are seen as the boy who cried wolf. You know, we say we can't do it, and then we figure out a way to do it because we care so much about the people we support, and we make the unworkable work. There is a limit to our resilience. We have no more rabbits. We have no more hats to pull rabbits out of. We need help. Our staff needs help. The people we support need help. Their families need help. And I would just end by saying that at the outset of the pandemic, we heard DSPs called, as we've heard, heroes and essential workers. How soon we forget. Let's not forget any longer. Thank you again for shining a light on these critical issues.
Thank you, Mr. Patterson. I appreciate it. You know, for me, who's relatively new to coming in and learning a lot about this world, can you just give me some perspective on what some of those rabbits are that are no longer in hats? Like, what are some of the things that agencies had to do to pivot to just maintain? And I think I know a lot of those, but maintain, you know, their own solvency and then maintain support for the people that need it.
Well, agencies have reduced management positions, have reduced leadership positions, have had administrative staff go years without increases in some cases so that we could put money down on the direct care workforce. So agencies are running very, very lean. Agencies are foregoing capital improvements that need to be done. You know, doing everything from renegotiating health insurance to looking at all of their benefit packages so that every dollar that can be squeezed out can go to the direct care workforce. We've run out of those efficiencies, and you get to a point where, you know, my agency alone, we've cut numerous middle management positions because we knew we couldn't cut DSP, so numerous middle management and senior management positions. Well, now guess who's covering the floor when we don't have enough DSPs? Middle managers and even senior leaders. And their ranks have been depleted, and they're burned out, and now that layer of people is leaving. So, you know, when I say the rabbits are gone and the hats are gone, those are just some examples, and there are many more. I often point to, you know, several years ago there was this capital nonprofit capital infrastructure program, and it was mind-boggling to me because it was like, all right, we're going to invite not-for-profits to apply for necessary capital improvements like roofs and, you know, IT and this kind of stuff, parking lots and all these things and furnaces that people haven't been able to do. Well, if you just put the money in the darn rate, agencies would be able to do it. You wouldn't have to run these superfluous grant programs. So, you know, agencies have just gone without doing those basic things that need to be done. So we heard earlier, agencies need to invest in their business acumen. With what? Using what? For money. You know, you got leaking roofs you can't replace. You got broken down parking lots you can't pave. And all so that we can just put every dollar we can into the workforce, and enough is enough.
Thank you for indulging me on that one. I appreciate it.
Yeah, thank you for your testimony. And one of the things that I just picked out from what you had said that I think is really important, and certainly something that you brought to my attention, is the relationship that these surveyors have from the Justice Center with many of the DSPs and the organizations that you're talking about. It certainly is something I think that we have to keep in mind here in terms of understanding what that relationship is, because while I can clearly see there's a value in making sure that we maintain standards, at the same time, that relationship can't be one that's punitive, especially, kicking you when you're down, so to speak. It sounds like people are doing everything they possibly can to keep the process moving, keep the wheels on the wagon, and to have someone come and have this sort of relationship where it's literally driving people away from the profession because of that relationship is just the state contributing to its own problems.
Yes, and very often there are power dynamics in terms of gender and race at play that some of these surveyors are not sensitive to, and I think we need to look at what the training requirements are for surveyors who work for the Division of Quality Improvement in OPWDD, because there is very little sensitivity. We've had staff in tears, and they're good surveys, not even very few deficiencies, but just the demeanor, people feel like they're under the gun, they're on the hot seat, and they get nervous, and very often they just don't want to be there when that's happening. It's very disturbing. And in addition to, in the middle of a pandemic, we literally had surveyors coming in and citing us on crumbs in a toaster. These are the kinds of things that and you're looking at it saying, we are literally fighting to keep people safe and alive in the middle of a pandemic, and you're telling us we have too many crumbs in the toaster. This is what providers deal with, that we should be, spending our attention and time lifting up this workforce, not tearing them apart.
Agreed.
Quick follow-up on that. Did the frequency of the surveys that were conducted decrease dramatically during COVID?
The in-person surveys did decrease, then they started up again. Now we're told they are going to be decreasing again and focusing more on COVID protocols. But for the short time that they did resume, there was very little recognition that we had been in a pandemic. So, you'd have a surveyor come in and say, why wasn't this fixed? And we would say, well, we couldn't have people come into the house for infection control purposes. It was not a health and safety issue, not a huge issue, just something that normally you would fix that you couldn't. And they would say, well, we're going to cite you on that. We know you couldn't have maintenance come in, but we're going to cite you anyway. These are unrealistic expectations.
Right. Thank you, Mr. Patterson. I appreciate all your advocacy and work, and safe travels back to Western New York.
Right back at you. Thank you. Thank you very much.
Thank you. Our next witness is Michael Searider, President and CEO of New York Alliance for Inclusion and Innovation, and on deck is Matt Graham. Thank you, Jeff.
Good afternoon. Thank you for the opportunity to testify, and happy Direct Support Professional Recognition Week to all of you. This is the time that we use each year to recognize direct support professionals for the amazing work that they do each week throughout the year. And on Friday this week, we will host our annual Direct Support Professional Celebration, recognizing the incredible work DSPs do. Unfortunately, there is also the reality, a reality, that the systemic failures we point to today have placed such superhuman burdens on direct support professionals that it dramatically impacts their ability, or any human being's ability, to support individuals with disabilities. Unfortunately, some self-advocates report that some desperate DSPs have told them, I'm the boss, or have threatened them with a behavior plan, or even worse, resorted to name calling, including one of the most disparaging words known to our system, the R word. These DSPs do not have the tools, the resources, the training, most importantly, the time necessary to support people appropriately, because that systemic failure has fallen on their backs. In fact, as Joe Macbeth said, it is a systemic exploitation of DSPs. Our system is backsliding alarmingly fast toward days not so long ago when the inhumane institutional warehousing of people with disabilities, which have since been abolished, were commonplace. Let me share with you some of the real-life examples taking place right now from our members. One individual, supported by a provider in the Capital Region, spent an inordinate amount of time in a horizontal position due to a lack of staff. This lack of movement led to something called peristaltic fatigue, otherwise known as a clogged digestive system, which resulted in a necessary hospitalization and surgery, which are also widely recognized as avoidable. Another provider shared that one of their staff with specific medical training went 5 consecutive days providing 24-hour supports to people with significant medical needs when no other staff with appropriate training were available. 2 weeks ago, an individual fell in a residence and was taken to an emergency room. The DSP was unable to stay with that individual due to the staffing shortages at the residence. Without the DSP present and the advocacy that they can provide, the individual was returned home, only to be returned later that day to the emergency room in severe pain for what ultimately was found to be several fractures in his back. Medication errors caused by exhausted staff have been reported by many of our members, which can easily lead to deadly results. A member in the Hudson Valley told us, quote, "We can't take individuals we support anywhere. It's basics only, health and safety, and even that's questionable on some days. We have people walking off the job in the middle of a shift when they realize there's no relief coming and the work is never ending." Another provider told us, "We have over 40% of our DSP positions open. We had to move people out of their own homes to consolidate with other residences due to no staff. Our residence managers are doing the DSP work. We're mandating staff sometimes for 3 shifts straight. We've stopped any community outings, and we're simply trying to keep people alive." Lastly, one parent asked one of our provider members, quote, "Does someone need to die before they actually do something about the crisis? And if someone does die, who are they going to point the finger at? Will they point it directly at the DSP who, because of this crisis, has been mandated to work over 48 hours straight? Or will they finally accept blame for their part in the crisis, failing to act, and increase the funding necessary to increase wages to care for our most blameless population?" Senators, the state of our workforce is a shambles, and it's on the brink of systemic failure. This is a failure, a systemic exploitation that is more than 3 decades in the making in my estimation. It is manifested in both a lack of recognition for the important work that DSPs do, but also the systemic racism and institutional bias within our society that has now infected governmental spending priorities. After all, the majority of our direct support professionals and individuals are Black and brown, and 75% are women. The current vacancy rate for DSPs, as was reported before, is nearly 25%, an increase of 75% since pre-pandemic levels, and the reasons are threefold. 1, compensation from government. The government provides for this work, which is physically, mentally, and emotionally demanding, has failed to keep pace with the rest of the market. Number 2, mandated overtime has become dangerously commonplace. And 3, the threat of criminal prosecution and permanent job loss for mistakes easily made when a person is exhausted simply doesn't comport with the low pay. So if New York State wants to demonstrate a commitment to creating more equity and inclusivity for Black and brown New Yorkers and for women, it can start by financially compensating DSPs and others in the caring profession for the work that they do. Here are 5 additional things that New York State could do. New York State can create a direct support professional credential to recognize DSPs for skill acquisition that will make them better DSPs, and thereby begin to create the career ladders and lattices that Joe Macbeth spoke about to allow DSPs to advance, yet remain in their profession. Number 2, New York State can advocate for federal recognition of the 100,000 direct support professionals here in New York State and many more nationwide by the U.S. Department of Labor with that distinct standard occupational code from the Bureau of Labor Statistics for direct support professionals. Number 3, New York State must bring to scale demonstration projects aimed at creating a pipeline of young New Yorkers to become DSPs and to advertise the DSP profession if necessary. Number 4, New York State can create innovative ways to make it more appealing to become and remain a DSP, for example, an income tax credit. And lastly, New York State can reform our state's system of supports and pursue changes to our federal Medicaid waiver authority to create flexibility in services for people with IDD, including expanded use of technology to support individuals that can augment direct DSP supports. Thank you for your time.
Michael, thank you very much, and thank you for delineating that out. I think it was sort of the perfect timing for, and we've heard a lot of these things before, but really some things that are manageable. Obviously, we have to fund it, but those other 7, 2 more, and then beyond are things that are logical, make sense, and really should be easily doable, or at least doable with a little bit of effort. So I don't have a question. I'm just appreciative of the enumeration for me, and sort of highlighting exactly the solutions that could lead us to a better place in a few years.
Yeah, no questions either. Thank you for your
Yeah.
testimony. As one additional thought here, we've talked a lot about the need for new money here. I think that that's part of the answer, but the other part of the answer is that we need a wholesale reform of our system. We really need to rethink and revisit the philosophy that our system operates in. Jeff did a fantastic job of articulating the minute details that provider organizations are focusing their time and attention on. We need to rethink it. We need to rethink the philosophy. We need a culture shift within our service system that really asks people like BJ, what do you want? And how do you want it? And focus on providing what he wants and how he wants it.
Yeah.
Thanks.
Thank you, Mr. C. Ryder. I appreciate it. Our next witness is Matt Graham, self-advocate, and on deck is Jim Moran.
Hello everyone, I am Matthew Graham, and I'm a self-advocate. I have been disabled my whole life, and I am very close to my birth mom, Leslie Spence, and bonus mom, Shirley Spence. I feel like we have always been close. We have been through a lot together, but I feel closer to them now ever since we are not living under the same roof. And I can come and go as we please. I believe that is the case because they don't have to worry about me anymore thanks to my staff, and I cherish the employees that work at the Center for Disability Services residential program that I live in. That being said, I am very observant, and also care about my staff's well-being. I have noticed that they are overworked due to the understaffing. Throughout the whole pandemic, my staff worked tirelessly to keep me hopeful and safe. They are proof that there are good people in the world that is willing to help someone like me cope with everything that is going on. We need more people like them, or at least willing to learn from them and come apply for jobs like my home. When my staff needs a vacation, it sends me through a panic. I ask questions like who is going to take me to my Special Olympics practices or any other outings I may have planned for that week. For that week that they need me time. They always tend to make it so that I can do those things, and I applaud them for that. My birth mom works in the same field that I live in, and it is very hard to get a visit out of her because of understaffing. I also work at St. Margaret's Center, a branch of CFDF's, and I have to work more hours than I would like because of the understaffing. I may not be a big fan of change, but we need more staff, and staff will relieve the tension that I sometimes feel in the house. So if you can help in any way to get more staff to help a person like me, that is a change that I will support.
Thank you, Matt. I appreciate that. Just ask you, what are some of, if you don't mind me intruding, what are some of the things you do at St. Margaret's?
I'm a resident life assistant. That's just a fancy way of saying I do activities with the kids that live there.
Yeah.
I have noticed across the board, not only in my department, we're understaffed, but so are the CNAs, the registered nurses. Everyone is overwhelmed, underpaid, underappreciated.
And you can feel it, it seems
Yes.
like. You can feel it from them, their frustration. Yeah.
Yes.
And they probably rely on their conversations with you to express that sometimes. Yeah.
Yes.
Have you seen more and more new faces that have to cover because of the staff? Or is it just that the staff that works in the residence are there longer and longer and longer because there's no other staff to fill in?
I haven't seen much new faces. In the past, I used to be a little annoyed because of staff coming and going,
Yeah.
but I've seen less of that, and I've seen more staff staying longer, which at times I'm relieved, but at times I see that they're just overworked, tired. They're able to get me to the things I would like to go to, and they're there to support me, but not. I see the tiredness they feel, like the crow's feet, the everything, the bags under the eyes. That's what I mean to say. But
Yeah. You looked right at me when you were coming up with that. What's one of those things that you love to do that either because somebody's not there or because you're working more at St. Margaret's that you miss? And you said you don't miss many times because of the dedication of the people that work with you.
Right. I love participating in Special Olympics, and my staff have worked tirelessly to get me to all my events. I've done I'm a multiple sport athlete in Special Olympics, and because some of the sports are in the same season, it kind of stretches the staff thin to get me to my sports and some of my other housemates to get to their sports. And
What's your favorite sport?
right now is powerlifting.
Yeah.
I'm actually been selected to go to USA Games in Disney World.
I thought you looked
for
familiar.
powerlifting.
Yeah.
Yeah.
Right. And how do you get to the site to train?
My staff takes me. They're currently not able to stay with me to train, but they drop me off and pick me up, and that's as much as they can do at the moment.
Yeah.
Because my house can be a little bit demanding on getting outings and.
I don't think when it comes to Special Olympics, there's any place in this country that has the team that the Capital District has for powerlifting. Am I right on that?
Right.
That's right.
I'd like to say
You got a great coach.
Yes.
Yes. I'm done. Anything else down there, Senator?
Well, Matthew, it was my pleasure to get to meet you and learn a little bit about you and the great work that you're doing. So please keep up the great work that you're doing. And I want you to know that we're all here to listen and we hear exactly what you're saying. And thank you for being so resilient, because I know this is a very difficult time, but you give us inspiration and you fill our sails with wind so that we can move forward. So thank you for what you do, and good luck in powerlifting.
Yes, thank you.
Yes, I echo my colleagues' comments too. Thank you so much for being here today and for being an advocate, and have a great time down in Disney World too with
Yes,
your
thank you very
Paralympics.
much.
It's awesome. Thank you.
Thank you, Mr. Graham. Next witness is Jim Moran, CEO of Care Design New York, and next following him would be Susan Constantino.
Good afternoon, Senator. I'd like to start by thanking you, Senator, as chair, and the entire Senate Standing Committee on Disabilities for holding this hearing. I'd also like to start by really thanking the self-advocates, BJ, who I've gotten to know fairly well over the last couple of years, and Matt and Sean, who is yet to speak, for coming here before us today to really tell us and make it a personal story about why we're all here and the importance of what's needed here to deal with the challenges that not only they face, but the people that they also try to support in their advocacy. So thank you to all of you. I'm the CEO of Care Design New York. We're one of 7 specialized care coordination organizations that are supporting individuals with intellectual and developmental disabilities. We support about 110,000 individuals across the 7 organizations. One of our primary jobs is to ensure that individuals with IDD get and maintain access to supports and services that will help them live a quality life. The current direct support workforce challenge is by no means a surprise, as we have said. It has been with us for many years and has gotten worse because of the pandemic. Some of the stats that we have talked about over the last 5 years, the DSP vacancy rate has ballooned from 9.3% to 25%, nearly 3 times higher. So what has been the impact of this workforce challenge on the individuals that we support? And as care managers dealing with 110,000 people, we get to see a lot of this firsthand. So I just wanted to touch on some of these. And I'm going to use Care Design New York's information specifically to give you a flavor of what we're talking about. We represent about 25% of the entire population, so we support about 27,000 individuals. In talking to our staff, more than 90% of our care managers have reported that many members that they support have been negatively impacted by the current staffing shortage. The greatest impacts to members has been the lack of community access for those who live in group homes, and community service access, primarily community and day habilitation services for those who reside in the community. Also, within the Care Design 30-county geographical footprint alone, 75 providers have reported a need to either consolidate, downsize, close, or offer limited days, hours of residential and day habilitation services for the people that they are there to support. Since January 21, Care Design New York has had 550 individuals approved to receive community-based services through OPWDD, yet for more than 50% of them, not a single IDD service provider has agreed to support them due to a lack of staff. This has taken a toll on our members. Our care managers report that many members have experienced or have increased emotional behavioral challenges that have resulted from their isolation. I want to just share 2 very recent real-life examples of how the current IDD system is failing our members due to the lack of a workforce. We support a married couple who have significant physical challenges and have been proud to retain their independence living and working in the community. These 2 individuals are now facing a possible residential placement as they cannot get the needed supports that they have relied on in the community for many years because providers do not have the needed staff to support them in their own home. We also support a person who inappropriately remains in a psychiatric hospital, who needs a residential opportunity within OPWDD, and even though the person is currently stable, and despite our advocacy and OPW support, we have not been able to find a residential provider willing to support this person. So they still are in a psychiatric center. The solution, there's many solutions offered today. I just want to focus on one. We should start with what is available to New York State right now through the Enhanced Home and Community-Based Services federal funds that were made available through the American Rescue Act. However, to address the IDD workforce shortages and high turnover, the state's proposal is to use these enhanced funds to finance one-time initiatives. And I repeat, one time, right? To the tune of $554 million. This plan is short-sighted. It's a huge mistake if it moves forward because it will spend $554 million and it will not address the 25% vacancy rate that exists today. It's not gonna touch it. And the notion of a promise to look into whether or not these funds can be extended is not an appropriate response. It must happen. It must happen. We need permanent funding and we need it now. Compensation and benefit increases are the first and most effective way to attract workers to these jobs with the goal to get to a living wage. And I did want to just touch on, senators, I wanted to touch on the definition of a living wage because several years ago when we were talking about when the state was moving towards raising the minimum wage, simultaneously we were advocating for the notion of a living wage for the workforce. Well, people got confused between a minimum wage and a living wage. They are completely 2 different things. The living wage is perhaps best defined as a minimum subsistence wage for persons living in the United States. It includes a family's likely minimum food, childcare, health insurance, housing, transportation, and other necessity costs is what that represents. It also keeps people off of other government subsidy programs, right? That's the purpose of a living wage. To get there, we need to finish what we started by the advocates, legislature, and the executive back in the fiscal year 18 state budget as part of the Be Fair to Direct Care campaign launched by advocates. In that plan, we proposed a multi-year plan to get to a living wage. That plan was stopped after the first couple years, was reborn again, but still has not kept pace with that effort. So what we think we need here to accomplish this is a multi-year financial plan that is a sustainable solution to this shortage, and it needs to be developed now. A plan that utilizes the enhanced federal funds only as a down payment. It needs to be a down payment to bring current DSP wages up to living wages, and then provide for ongoing cost of living increases, which, as people have testified, have been non-existent in this field for 10 years. In addition, it is critical that, unlike the previous wage increases given, all new wage increases not be funded by cutting IDD service provider rates or by reducing services to people, which are some of the proposals that have happened to us over the last several years. It's you give it with one hand, take away with the other. And that's not the way to operate a system of support on the backs of the people that need it most. In closing, on behalf of the 7 CCOs and the 110,000 individuals we support, we'd like to extend our appreciation for this Senate committee holding this hearing and ask that the state legislature follow this up with action in working with both the executive and the advocates to save our failing IDD service system. Thank you.
Thank you, Mr. Moran. I appreciate that. I'm going to ask for an opinion here, which would be if the rates are adjusted and the agencies are properly compensated. In using the term living wage, do you think, because I know there are bills out there, 20% above the minimum wage is adequate or a good place to start or something for us to focus towards?
I think, Senator, there's Massachusetts Institute for Technology has done a lot of work over many years back in the early 2000s. And that's where, when we did the initial, I was fortunate to be a part of the advocacy group that worked on the initial Be Fair to Direct Care campaign back in 2016. You know, they have very reliable data and they run it all the way down to by county. You can run data by county to show what's an appropriate living wage. And that's what we used back then when we had done the analysis. We were working from, again, it's information that is true and tested. It's not a made-up number by anybody. It's based upon data, real data. And we use that to develop a proposal. And my suggestion would be is that we go back to that, look at that updated data, you know, look at the various regions of the state and come up with what's an appropriate wage to try to get to based upon where things are in those regions right now and what's it going to take, what's the cost associated with that to deal with that. And then the last issue that, and it was brought up by Jeff Patterson, was the word dealing with the fact that you have workers that, you know, once you raise to a living wage, it's the issue of what happens to the other staff who have maybe risen to a certain point in the organization. The notion of you need to deal with that workforce as well. And that was like a dirty word. Nobody wanted to talk about that the last time around. And that's something that also has to be factored into the equation. So it's dealing with the living wage and it's dealing with the other levels of support that are above those folks to keep them in those jobs so they don't leave, because now the people at making a living wage are really where they are right now, and you need to advance them to some degree as well.
Quick follow-up, and pardon my ignorance, which would be the MIT study based on Massachusetts county data. So it sounds like Massachusetts has a model that there's different, I guess, unique minimum wages to be paid in each county in Massachusetts based on that data?
Actually, that's an interesting question. I actually don't know if the state of Massachusetts is actually using the information themselves. But they, MIT does this as a national. It's not just like, they do all other states. They look at the various counties. And it's tried and tested. I mean, it's over 20 years that they've been doing this. And again, I think it was accepted several years ago when we did this work by the state as a true source of information to use, to build from. And I think, again, it's why try to do something, what feels like a good number. It's using that data. And clearly, and I think it was the testimony of one of the parents who spoke, you've got to be north of $20, in all honesty. It's got to be north of $20 an hour, particularly when you get downstate. A $15 right now minimum wage, you've got to be much higher than that. And I think the data definitely supports it when you look at the MIT analysis. It supports definitely raising these wages to these folks who do incredible work day in and day out to support people. To live a quality life is what it's all about, and that's been crumbling, in all honesty.
Pardon my ignorance on this one too. Be Fair to Direct Care there were differences based on regions.
Correct.
Within that program. Thank you.
Yes, that's correct.
Or campaign.
Yeah, and what we did too, Senator, we didn't do, adjustments for all counties, for example. We kind of looked at regional. We did it kind of on a regional basis. And and again, it was accepted by the state as a reasonable formula to get there. What wasn't committed to was the multi-year commitment that was needed at the time. Yep. People thought, well, we took care of that last year. Well, no, you didn't. You did it for, you did 2 adjustments, but you didn't continue it. And it needed to be, and I think other people have testified to that. This has to be an investment that's done over a period of time. And this is just one issue to grapple with. And I also agree that you need to do more than this. It's going to take the other things that have been recommended by other presenters today. It's got to be looking at this from a multi-perspective basis in order to really solve this problem, because money alone won't solve the problem. As we've heard testimony earlier from the state workforce unions, right, who ironically, their workforce are paid substantially better than the not-for-profits, as you know. And then we heard the commissioner today announce a $4,000 raise for starting wages, and I'm sitting back there and I'm looking at the faces of the people here who are testifying now, saying we're now further apart, right? Yep. And a DSP is a DSP. The work they do, it doesn't matter whether they work for the state or the not-for-profits. We can't value one more than the other, and that's what's been going on for many years. And that has to end. And that has to end, right? And the government has to step up and deal with this. And again, I'm not saying what's been done for the state workforce is wrong. It's absolutely correct, but we need to step up for the remaining, which is the majority of the workforce, as you pointed out, Senator. It's less than 20% are supported by the state. 80+% are supported by the not-for-profits. And we have this inequity that's been going on for many years and continues. And you saw the struggles that the unions were bringing to the table. So it shows you that the issue is more than financial, but on the not-for-profit side, you've got to start with the money while you're still working on these other issues that also have to be brought forward and dealt with. So.
Thank you. I have nothing else. Thank you for your testimony.
Yep,
Thank you, Mr. Moran. Appreciate it. We have 8 more individuals to testify. There's been an executive decision by the ranking member, no, a collective decision that we plow forward. So if there's anyone entirely disagreeable to that, speak now or forever hold your peace. But we're going to keep moving, if that's okay. And rather than take a break, next up is Susan Constantino, President and CEO of Cerebral Palsy Associations of New York State, and following that is Tanya Anderson from Arise.
Thank you, Senator Mannion, and thank you, Senator Martucci, and thanks for deciding to go forward. I was afraid you were going to take a break. It's going to push us further away from my 2 o'clock phone call. I am Susan Constantino, and I'm the CEO of, and I love to now proudly say it after Michael Bolton testified, of United Cerebral Palsy Associations of New York State. And 44 years ago, we did take 600 folks out of Willowbrook And we were able to place them in apartments and homes throughout New York City. And as he said, we were able to do that because we could hire a workforce, and a workforce who wanted to work. We paid them at the time what was a better wage than perhaps what they could get in a minimum wage job. But what's really outstanding to me is that some of those people still work for me today, 44 years later. So it's really quite incredible. These are careers for people. We talk about them as jobs, they've become jobs, but they are careers for many people, and those are the folks we want to bring into our organization. People have said everything that I was going to say today. So I thought what I would do is just go to the part where I would tell you, we represent about 19,000 workers across New York State. I myself in my own agency have almost 1,200 direct support professionals. And what I've done is just to ask folks to tell me what people say on exit interviews when they leave. Why are they leaving? What is about this job that you don't like? What we have found for the most part is that in my agency in particular, we probably hire about 25 or 30 people every 2 months, and we probably lose about 30 people every 2 months. Some are people in and out, some are folks who are ready to retire and by attrition are leaving, but many are really in and out. It's not the job they thought it was. The first thing that they say across the board is money. I need more money. We all kind of have said for years our folks have many jobs. They have many jobs because they can't afford to live on one job. And when we're fully staffed and we don't have overtime for them, they really can't afford to live, which is why they have 2 jobs. Now they are accumulating so much overtime, they work overtime so much, and then this is the second piece, but we cannot take any longer the mandated overtime. Everyone knows, and it was lovely to hear, and I think it was the woman from CSEA who had said, our folks don't go. If you're in a home and someone doesn't show up and your child needs to get picked up, you figure out a way for your child to get picked up because you stay. That's their mandated time. They must be there. But I can't tell you the number of phone calls I get, the number of complaints we get from the unions that represent, we have 4 different unions that represent our folks, that the mandated overtime is the single worst issue that they have. And in fact, their staying with us may mean that they're not showing up at their second job. And so therefore, there's more mandated overtime in another place. When I said, what is it? We thought we were going to have a career, but this is different. We're always tired. They certainly are tired. COVID did not create the problem. COVID exacerbated what was a bad problem before. And without enough people, they're doing 2 people's jobs. Your minimum may be 2 people that have to be on a shift, but usually you have 2 or 3 or 4 people who come in to do transportation, people who come in to go on outings or whatever. You don't have that anymore. So what they thought they were doing as a career, enhancing and working on helping people lead lives, they're not. They're doing the tasks that have to be done. And while they all have to be done, they're not what they wanted for their career. They want more opportunity to learn new skills. They want more opportunity to take classes, not necessarily, and I love what Joe Macbeth said, not as a career ladder to become a supervisor, but to become a better direct support staff, to learn the skills that people need to become a better direct support staff. And mostly they say, we want a job that pays us enough that we don't need 2 jobs and that we can also have a life. And that doesn't seem like a lot to be asking of anybody for what they want in their career. What I would really wish we could see is that I've been, as many people have been in this career, in this field a long, long time. we're not partners anymore with the state. We really are all working to try to get what we need to get. We're not partners working together. I wish what we could get out of this is a partnership, because it's not our problem, it's not their problem, it's our problem, and we really need to work together to solve this, or everything that we've built up for all of our years is going to disintegrate. All of our data is not in my paper, it's all in the NIDA paper, because we've worked very closely with NIDA, so that's where it all is. Mine is more from a provider level to just tell you that we really do need your help going forward. It's not a one-shot. The enhanced FMAP is great, but you know, when we got to the 5-1 cuts, and I'm sorry, but I don't want to forget this, the 5-1 cuts, I heard the commissioner say today, well, we did that, that's the vacancy, to take away the vacancy factor. We did that so that we didn't have to take a 2% cut. That wouldn't have worked. Well, for some agencies, it's a 5% cut simply to their residential program. For my agency, it's a $6 million cut. And since we don't know if that's going to take place or not, we have to reserve the money. Yeah. If I've created a budget without that $6 million in it, think what I could do with that $6 million. Think how I could give that to the staff in order to be able to increase their salaries, but instead I have to know that I may have to give that back. And so we need answers. We can't be just left to like sort of plod along waiting, and we need our partner back. Thank you.
Thank you. I don't think I need to ask you a question, really, to be honest. So I appreciate the testimony, and I think you landed it right in the right spot with everything that's already been said, and a great summary to that. So thank you.
Yeah, thank you, Susan.
Thank you. Our next witness is Tanya Anderson, president of Arise Central New York, and on deck is Marianne Allen.
Good afternoon. Thank you for conducting this critical hearing. My name is Tanya Anderson. I'm the CEO of Arise Child and Family Service, and I'm here to give you the perspective of the leader of a relatively small voluntary provider agency, but also as a parent, someone who's been trying to put together staff for 16 years now. Arise is the independent living center in Central New York, and we serve the counties of Onondaga, Oswego, Madison, Cayuga, and Seneca since 1979. We serve about 500 people in our ComHab, respite, and employment programs. The work of Arise really depends on DSPs, and I want to highlight some of the impact the shortage is having on us as an agency. In our ComHab program, we've got about 120 people who are qualified for services, but they're not getting help because we can't find the staff. That's 42% of the people that we would serve. For the very first time, this agency has a waiting list for ComHab, something we haven't had before. People who've gone through the eligibility process through OPWD now are waiting even longer for access to the community. In our respite program, 13% of the people on our rosters are not getting service because we don't have the staff, and we have a waiting list of 30 people. We've had to stop services like employment in our rural counties of Cayuga and Madison because we cannot hire the job coaches, and this was before the pandemic. As a mother of a child with a developmental disability, I can attest firsthand at the critical impact that direct care staff have on my daughter's life. She would not be successful in school and the community without these people who care very deeply about her and are very loving and professional and giving and just so connected. And it's a real loss when they have to go, when another job comes with a few dollars more. I've resorted to private pay, and I can tell you the rate that I have to pay is north of $20 in order to get staff. And they are wonderful staff, but I'm grateful that I can do it, but most families cannot do that. Low pay is overwhelmingly the reason why staff are leaving and providers like Arise cannot hire these staff. We can only offer a starting wage of $13.44 per hour. We have staff who've been at Arise at DSPs for 10 to 15 years that are making about $15 an hour. Wage compression is a huge problem. And these folks are in it not because of the money, because they are so dedicated. They're working multiple jobs, much hardship, and they're not getting the rewards. Arise can't compete with the retail providers. We can't compete with individuals who have self-direction plans that have a bigger budget that can offer rates of $18 to $20 an hour. We certainly can't compete with the state ops rates, and that was before I knew about the increase that was coming down the pike. You've heard about the dedication of direct care staff. I don't need to go into that any further. Let me tell you a little about what we've done at Arise to try to recruit direct care staff. We've had advertisements, community events, a bonus program with our staff for a friend, get a bonus. We've even put signs on our building. None of it's working. Even before the pandemic, it was very routine for people not to show up at a scheduled interview. Our turnover rate is 30%, which is up from pre-COVID. In the first 2 years of our DSP programs with ComHab, we are looking at a rate of only 43% that are still around after 2 years. Staff are moving from agency to agency for a couple of cents. And this has a huge impact us as an agency because it does cost us between $4,000 to $6,000 to train a new staff person, and that churn is real money that we're losing. If I combine as an agency the churn that we see in DSPs and also in our CDPAP program where there's another shortage, we're talking about $675,000 a year just for Arise as avoidable cost. This is a long-term problem and we need some long-term solutions. And of course, providers' rates have to have a wage, have to have enough funding to allow us to have a living wage and also benefits. Small things like increased mileage reimbursement in rural areas would help us. And also we talked a lot about having this be more of a career path and having our provider rates be able to recognize and reward staff who take that initiative. What I've not heard is that, what I hope is a fairly simple fix is that if we included in our billable rates reimbursement for the training time, that would be significant. We invest as many as 20 hours for a new staff, and this is really important time. It's the required trainings. It's also getting people familiar with the safeguards, getting them to job shadow a little bit so we don't hear the horror stories where someone walks into a situation and they're just not prepared. So I'm hoping that's a relatively easy solution. So in conclusion, I urge you to invest in the pay of direct care staff and really invest in the programs that allow people with developmental disabilities to fully participate in the community, people like my daughter. New York can ensure that a career in direct care is respected and rewarded, commensurate with its real responsibility and impact. Thank you very, very much.
Thank you for your testimony. And I don't want to reduce all of your comments to this, but I'm going to ask this one question that's a little bit in the weeds. What kind of success did you see or not see with the Find a Friend bonus? Was there a level of effectiveness to people doing, some of your own DSPs doing their own recruiting to be people in, or and obviously of all the things you talked about and others, this is not going to solve our crisis anyway, but just for my own knowledge.
I think we got one referral out of it.
Yeah, right. And that's what I would guess.
Yeah.
It sounds like, it has its potential, but in reality, people know that these positions are out there, or it wouldn't take too much effort to find them. I certainly see in my social media feeds those available spots. So, anything else, Mr. Martucci?
The only thing I just wanted to touch on, certainly, and you're probably about the third person that said it, and again, it's sticking with me, is just the tremendous costs associated with turnover. I mean, to hear that you're spending nearly $700,000 a year just to address that routine turnover. And the reality is that those are resources that, eventually we should be looking to push into wage. So by us addressing, coming up with solutions to address wage, increase wage, it only helps solve that problem for you as well. So,
absolutely.
I would tell you that again, that too is not lost on me, and that tremendous cost and that tremendous effort that you constantly are putting into training new folks.
Absolutely. Thank you.
I'm going to put you on the spot for one more. I think you referred to a phrase as enhanced wage. Maybe you didn't.
I probably meant to say living wage. But
Yeah, okay. All right, so I'll just pass on that then.
okay.
All right, thank you very
Thank
much.
you very
I
much.
appreciate it. Yep. Yes, next Our next witness is Marianne Allen, represent the Eastern New York Developmental Disabilities Advocates, and following her will be Scott Phillipson.
Good afternoon, Senator Mannion, Senator Martucci. Thank you for allowing us this opportunity to come before you today. The Eastern New York Developmental Disability Advocates is a group of parent and family volunteers based out of the Capital District in upstate New York who advocate for our loved ones with developmental disabilities. We're a completely volunteer group. We're not affiliated with any agency or provider association. And we do this out of the love of our hearts and out of our love for our loved ones. I am the parent of a 34-year-old young man who is profoundly impacted by autism and intellectual disability. I have had the blessing of working with DSPs across a wide a wide variety of situations, beginning in my home when my son was young and lived with us until he was 24 years old. And during that period of time, direct support professionals provided my family, not just my son, but my family, with the support that it needed so that we could stay together, so that my husband and I could go to work every day, so that my son had meaningful social activities outside of just his relationship with his family, so that my younger children had the ability to grow up without constantly having the challenges of autism in their face. When Matt was 24, he had a profound behavioral crisis and was unable to participate in any of his supports and services, and ended up, because he hurt my husband and I, who were at that point his sole caregivers, enough that we needed time to heal our own bodies. He ended up in the crisis program for adults with autism at ODHEC. And there, it was the DSPs who put him back together. It was not us. We had tried everything and were not being successful. In retrospect, we believe, although he'll never be able to tell us, that the crisis resulted from the fact that he was watching his younger sisters go away to school and start their own lives, and he didn't want to be home with mom and dad as his sole support system for the rest of his life. And he wanted a life as an adult. He wanted his own life as an adult. The DSPs that he worked with at ODHEC gave him that, and they helped him put himself back together to a point where he's now living in a community residence in the community. The horrible behaviors, and he's a big man, he's 6'4" and 300 pounds, stopped on a dime the day he moved out of our house. And it is the DSPs who have become his social network, who have become his support system, and who have allowed my husband and I to be mom and dad for the first time in our lives. I say all of this as background. My story could be replicated by many of the parents with whom I advocate and with whom I am part of this group, and all of the 140,000 families in New York who deal with this issue. It is an honorable, valuable, needed profession. And for the last 10 years, New York State has disrespected it. We need at this point, and this workforce needs at this point, an official commitment from this state in writing, in every possible way that we can give them, that their work is valuable, that it is meaningful, that it is having a positive impact on our society, and that we support it and want to have them be part of our communities. Relationships are key to everything at the end of every day. One of the biggest fallouts that I have seen in this emergency that we're in right now is the mental health impact on our loved ones when someone that they trust walks out the door and they don't understand why. And those people often walk out with tears in their eyes. But the ramifications, the last staff that Matt lost, who was not able to stay, left with tears in her eyes, he didn't get out of bed for 2 weeks. And that impact and the fallout from that, if we allow it to continue, is going to create a much bigger problem. The commitment that we need is to make the DSPs a priority workforce in the state. That means fighting for them come hell or high water. It doesn't mean what we've done for the last 30 years, which is wait and see how the budget shakes out, and if there's any scraps left on the table, we'll throw them at them. And then we'll find a way to take them away in another way through administrative action. It's wonderful that we're looking at the American Recovery System monies, but that's federal money. That's not a commitment from New York State. That's using money that's given to us from another source to fix our own problem that we've created. We need a long-term commitment that is not just a one-shot Band-Aid. And we need to pay these people a living wage that values the work they do for us. It's wonderful that the commissioner has been able to find resources to pay the state DSPs within the month an additional salary. But as many people here have spoken today, a direct support professional is a direct support professional. And I would hope that New York would find a way to provide that same equity of respect and dignity and support for all DSPs. And the last thing, from a family perspective, is that there needs to be accountability from the agency to which this money is entrusted. Over the past 10 years, there has been a huge drain of resources to various bureaucratic endeavors to, you heard the survey system and how many crumbs there are in a toaster. That all takes resources away from families and the supports they need. Those resources, when the commitment is made, come back to our community. The direct support professionals live in our community. They spend their wages paying their mortgages, buying groceries, supporting our community. It's not a handout. It is a valuable piece of the economy of our communities. And particularly in upstate New York, this workforce is a huge economic driver. We need to stop looking at this as a charity. It is a reality that more and more of our loved ones are going to be born with and live long lives with developmental disabilities. And they bring an incredible value to the community. And it brings an incredible value to the community to have families stay healthy and to have both parents be able to go to work and to have marriages stay together and to have siblings be healthy. So it is time for us to do something different. I am greatly encouraged by everything I've heard today and by this hearing, and I deeply appreciate the opportunity to testify on behalf of families.
Amen, Mrs. Allen. Thank you.
You're welcome.
You really
Thank
got
you.
it. Yep.
Thank you.
Our next witness is Scott Phillipson, President of SEIU Local 200 United. Following him will be Sean Foltz.
Thank you. I want to appreciate everyone who's spoken today. I'm going to be brief. I don't want to repeat things, and I appreciate the senators for having this opportunity to share. I'll tell you a little bit about my union and a little bit about our perspective on the issues that have already been spoken to. I don't represent any state workers. We're a union of about 15,000 folks across New York. I represent exclusively workers in this industry, the DSP profession on the private side, and it is a tough place to work. That is irrefutable. It was tough 20 years ago when we started organizing these shops. It is tougher today, and it doesn't get easier. And it's emotionally draining for folks who care so deeply about the work that they do. And we in SEIU know a bit about that. We have a history of representing workers in nursing homes and other care type work in the state. And so we were honored to continue that work in terms of representing these folks. You know, nothing's new about the crisis. We've talked about it. We've eked out COLA adjustments. We've eked out little things over the years, but nothing has really turned the corner. You know, I've watched members lose their jobs through the Justice Center, as other folks mentioned. I've watched members who, frankly, I thought we affectionately would refer to as lifers, folks who got the bug, love this work. You would never want to leave this work, but just after years and decades of being sort of beaten down economically, you come to the realization that there's really no hope. And that's sad to see. That's sad to see because there is the issue of wage compression that's been wholly ignored over the history of these issues. And I do think minimum wage has changed the conversation, right? It's changed the expectation, and that's not all bad. The fact that folks who flip burgers get $15 an hour is frankly still not a living wage. Where I live in Syracuse, New York, we did the analysis. One of the speakers talked about MIT. We did the work in Syracuse, New York. We passed a living wage ordinance in the city of Syracuse. And when analyzed, I'll tell you that today, I just checked it this morning, is $16.10 to live, just the basic subsistence living in Syracuse, New York. So certainly $15 minimum wage, which exists in other parts of the state, but $12.50 upstate, with frankly an uncertain path, would create a floor, at least to force those, outside of those who have graced us today with this hearing, but your peers in the state legislature, to truly understand and force the issue to be looked at the way it needs to. A living wage isn't a minimum wage. Our folks, and these are in unionized shops, and mind you, I don't know if you're aware, but a sliver of the industry outside the public sector is union organized, collectively bargained. You look at our start rates, we have folks that live, I want to sort of pick on certain agencies we represent, but $13.05 to start at an agency in the lower Hudson Valley, where the standard of living is certainly higher than what we would enjoy, particularly in Syracuse, New York. $13.05. That's slugging it out with the employer at the bargaining table, and it's wholly insufficient. You look at other agencies, similarly, maybe we've been able to get to $14.50 to start. They still have the same turnover. Experiments on money, I mean, you look at it and just looking at the economics, the 1% COLA on a $13 is 13 cents. That's $260 a year if you work a full year. That's literally nothing to change somebody's life. It just needs to be improved. We're in the process of doing some surveying our members, as we usually do, going into the budget. I was just looking at some of the feedback. We have members that have worked in this industry for 24 years who make $16.83. You talk about wage compression, it takes decades of working in this industry with 1% and 2% or no hope for an increase just to get to not even $17 an hour. That is a travesty. And so what beyond the money am I capable of adding in value today? Well, I'm here to tell you that I speak to folks who work in this industry, and I'm not their employer. And I would look at the good Senator Mannion, who is a union leader in his own right, and people say different things to their union than they do to their employer. I won't say whether it's better or worse. And my folks are frustrated. They're frustrated for the people that they take care of. They're frustrated for the state of their employers. They're frustrated for themselves and their families. And they're almost beyond a breaking point. For the last 20 years that we've represented these members in this industry, I can say that even when contracts were slim, we were able to eke out some economic benefit or some changes in other terms and conditions of employment that don't cost a lot of money to improve their lives, and we were able to get these contracts, as we call, voted or ratified by our members. That's not happening. I had one rejected on Friday. I plan on having another one rejected soon. Members are beginning the conversation about preparing to strike in this industry. That's the distinction between the public sector side that Fran and Pef talked about and my members in the private sector side. I venture a guess to say that it will not be too long before we issue a 10-day strike notice to one of these employers in this industry. Now, that may be a shock to some of the folks from the employer side that are behind me, but I'm telling you it's real. It is scary in the sense that if you talk to folks about the prospect of leaving the people they serve to walk out on strike, there is tears in their eyes. But I will say in SEIU, there was a point in time in the history of this nation where we never believed that nursing home workers would walk out on folks they cared for because it was essential to the people that they cared for, that they raise wages and they turn the tide on turnover and the poor conditions in those places. And we are close, folks. We are dangerously close. So I think there's clearly a sense of urgency. All I would say to add to that is this is a state problem. The state has created it. The state needs to fund it. But the solution should come with some caveats from my perspective. All the employers we deal with are not all as magnanimous as some would say. They've played games with money that's come from the state and not always passed it on to the direct support professionals. I won't say that's the majority of the industry, but it exists. We bargain across the table from high-priced corporate law firms from Jackson Lewis that cost $600-700 an hour, while we're arguing about whether or not we can get a $260 a year raise for our members. There's something wrong with that picture, folks. So I would just urge, whatever the problem is, everybody, what stuck with me today, whoever spoke, was this idea that at the end of the day, there should be a commitment that people need these services. And to do that, we need to fix the wage issue, we need to fix the turnover issue, we need to fix the wage compression issue. And we need to treat the people who do this work with dignity and respect. And we will do our part as a union to make sure that we anchor those rules in, that people are treated fairly, and that we support them in the work that they do. Thank you.
Thank you, Scott. I appreciate the, highlighting a lot of things, but including the role that you play within the private sector and the fact that there's room for that. And I also agree with you that in many instances, my experience was that it's easier to be angry at your union president than it is to your boss. But that being said, when you look at the number, again, I'm going to throw this out there, some contracts that negotiations that go unresolved. What's our most extreme scenario? Like, how long have we been in negotiations and
We're in perpetual negotiations, Senator, because
yeah,
of the
sorry
way.
about that.
Yeah, I mean, this is the thing. So
Yeah.
if we negotiate a 3-year contract with a particular employer, we have wage reopeners each year. Why? Because we don't know what the wages look like next year. There are some employers that are willing to go out on a limb. I will give credit to a smaller agency in the Cayuga area who went to their board and said, we need money out of our endowment. We need to go to $18 an hour minimum wage to start. And we can't get that money from the state. And we can't let the people that we serve not get what they need. But that's unsustainable as well. And while I give them credit for doing the right thing for those folks, they're teetering on the brink. And that isn't a good situation. Yeah, the truth is that's fatigue as well. The constant, one of the things that a union contract provides is stability, predictability. On a completely different note, but recently we negotiated a 5-year contract with Syracuse University. Never would have imagined in my time in the union of over 20 years that people would be so appreciative. But that predictability of knowing what my wage is going to be next year, the year after that, the year after that, it provides comfort. It provides you the ability to go get a home, maybe a car, something a little nicer if you can do that. We don't have that in this industry. There needs to be a plan that goes out forward that says, how do we get a path to a living wage? Put it down. We put out a path to get to $15 minimum in the fast food arena. We put out a path to get to minimum wage increase. We need to get to a path to a living wage. And I agree with someone who said you need to get, look, $20 is the new 15. We need a path that really speaks to the needs of this industry. And if you build it, people will come. Even if it's not today, if they say, you know what, in 3 years, I can be at this amount of money, you'll get people that are interested in that. But right now, they're not going to make it through. Most of our folks don't make it through the first year. Our data internally at the union shows a 65% turnover rate. That's what we see. The agency that went to $18 an hour, they have barely 350 workers. They had 129 open positions. That's the kind of crisis that we see on our side in our little sliver of about 3,500 workers in this industry that we're privileged to represent.
Thank you for that perspective. I didn't ask the question right, but I got a good answer.
Oh,
So
wow.
I appreciate that. Yeah, thank you very much.
Thank
I do
you.
appreciate it.
Yeah, thank you for your testimony.
Thank you.
Yep. Next witness is Sean Foltz, a self-advocate, and following him will be Eric Geiser.
Thank you for the opportunity to speak. I know it's been a long day. So I'm not going to rehash what others said. I'm just going to tell you what's happened to me in my real life, okay? In April of last year, a staff ahead for 4 years left. I could not hire someone fast enough because she worked day shifts. So my wife also works as a DSP with another person. So what she had to do was go into friendly to make sure I'm okay. And fortunately that worked out, but it took 2.5 months to find somebody. And the way I find people is I look at friends first, and I have to go on Facebook to post ads. My agency has, like every other agency, has a lot of open positions. And of course, since I'm in self-hired, self-direction, they won't help with that, of course. They just say, find someone, we'll bring them on board. But I'm also a support worker as well, so I know self-direction quite well. And a lot of the people that I've worked out as a support worker don't have staff either. So it's definitely a huge problem. Currently, I pay $15 an hour, which is better than some, but still only minimum wage for fast food workers. I've been in self-direction now for about 7, maybe 8 years. And over the course of that time, OPWDD has given me a total of 6% increase in what's called my PRA, which is included by my scores on a form called DEP2. And with that, I've been able to get a $1 raise to all my staff over time. That's over an 8-year period. If I had more money in my budget, I'd be happy to up their wages. I'd feel nothing would be happier, actually. Because the people that I hire, I see they have problems with having appropriate cell phones to keep in contact. I see they have problems with transportation to get to me, to take me to places like this. I see they have problems with housing. That's all related to the amount of money they make. And now, because of federal mandates, we no longer work with paper to do our daily logs and mileages and all that. It's now things like Evero and Precision Care, which require the use of smartphones or tablets that in many cases I have to provide to my staff because they don't have those things. So I provide my own tools for them to do their job, whether at my house or in the community. And I gladly do that because it has to get done. The other thing I've noticed, because I am a support broker, is agencies have to pay for the health insurance of their employees. And I do appreciate that. But the way agencies pay for it is increasing what's called the fringe rate that I pay per hour of service that I get. So if I pay $15 an hour and I have a fringe rate of 33, I'm actually billing Medicaid 20-something an hour. Well, when you have as many hours as I do, because I budgeted 85 hours a week because I have intense needs, when you increase the fringe rate from what it was to what it is now, that takes a pay raise off the table because my budget doesn't increase to accept it. I have to take money out of something to handle that. So that's how self-direction works. And that's why the easiest way to help me is increase the amount in my budget, and then I'll pass it on to my staff immediately.
Thank you. Those I took away, those last 3 items are things that I don't think, we've heard a lot of, and certainly in my experience, it's good for me to hear that. Can you talk to me about the 6% increase over the course of 8 years and how that is, again, my own ignorance, how that's determined and where that number landed on, why it got to that number?
Well, what happened was there was a 5% increase a couple of years ago that was just surprisingly handed out by OPW. And it was announced on the broker quarterly meetings that we do. Because I'm required to maintain the broker, I have to go through 12 hours annually of training, where OPWDD basically talks to me about various issues relating to brokering. And they mentioned a 5% increase at one time. And that was enough for me to increase wages from 14 to 15. Mm-hmm. The other thing I should mention about self-direction is even if I sat down today and redid my budget and raised it to 16, it would still take 4 to 6 months for that to get approved and get back. 4 to 6 months before my staff would see that money increase. And right now, to get that, I have to take money away from something else.
Thank you for that also. That's new to me as well, So I appreciate that, I have spoken with other members in the room and, self-direction can be, a wonderful experience, but when you have increased costs and there's not the any ability to cover those. It's a challenge, but it's a learning process for me, and I think, I appreciate you sharing all of those perspectives.
The only reason that self-direction works for me is because I happen to live with someone who's also a DSP. So when my staff don't call in, I know I can count on her to step up and provide the care I need. Otherwise, this program would not work.
Wow.
Because if someone calls out, there's no one to bring in to cover the shift.
Mm-hmm.
Relief system does not exist in self-direction, and overtime is not allowed. So then my wife, who went on the emergency medical leave while I was looking for new staff, is the one that will cover a weekend if my weekend staff doesn't show up, or cover an evening if my evening staff doesn't show up. Or if my morning staff is late, she'll come back and make sure I get dressed so that I can get here on time. That's what she does. It's invaluable. And she can't bill for any of it because she's not allowed to be my staff.
Right.
And I'm sorry for the way I began. I get nervous when I talk to people.
You were great.
Then I calm down.
I can't believe you're apologizing. You were fantastic. So all of those things, again, I think as somebody who wants to know more and wants to understand, I appreciate the fact that you sort of allowed us to hear the details of where, you can get a certain, it's way beyond the basics of what it was. And those things you shared for me are very helpful. How we improve those is probably a lot more complicated than that. But I do appreciate that insight into your world because I don't think people see those challenges there. And we would all agree, and I've seen it, in my own family's lives, that when you have somebody there who can fill the gaps, they do. But that's great to have that as a backup. But unfortunately, that's not the way it's supposed to be.
Right,
And-
it's not
and
the way
not
it's
everybody
supposed to be.
Yeah.
And if I don't have daytime staff, my wife can't go to work.
Right.
So that affects us financially. That's why I look for daytime staff first and then fill my other shifts in where I can.
Right.
But I've had a lot of turnover. My daytime staff left in April, my weekend staff left in March, and I just got daytime and weekend staff that I had to find, bring on board, get hired, all on my own. The agency didn't find anyone for me. I had to do it all myself. They just came on board in July. So it was a long road. And we can do better than that.
Right. I agree. Thank you for sharing all that.
Yeah, thank you for your perspective, Sean. Really
Sure,
appreciate your time
no
today.
problem.
Thank you for coming out.
Thank you.
Thanks, Sean. Our next witness is Eric Geiser, CEO of ARC of New York. Is how I have to call it, being from Onondaga. And on deck is Melissa Stickle.
Good afternoon. Thank you, Senator Mannion, Senator Martucci, and other esteemed members of the committee for holding this very important hearing today. My name is Eric Geiser. I am the CEO of the ARC New York. The ARC New York is the largest not-for-profit provider for people with IDD in the state. We serve 60,000 people across the state. We employ 30,000 individuals through our 37 operating chapters. And some of the parents that created our organization were among the earliest to advocate for quality services and opportunities for people with IDD. Today, we've heard about an escalating crisis in our workforce that has pushed us really to the brink. For years, you have heard us tell you that these supports and services are at tremendous risk. I'm here to tell you the future is here. It is now. According to a recent survey, almost half of the providers needed to close or reduce services and supports for individuals with IDD. We are literally closing the doors on the very programs for whom it is our mission to provide opportunity. Without adequate investment in our field, we are unable to pay our dedicated staff a competitive wage. Our direct staff are amazing. Some of the activities they perform are supporting activities of daily living, administering medication, tube feeding, wound care, mobility support, oxygen administration, physical, behavioral health services, transportation to critical appointments. These are not minimum wage jobs, yet in most regions of New York State, the DSP wage is less than $15 an hour, which is the minimum for fast food work. In Albany, right here, the average starting wage for a DSP is $1.50 lower than the $15 minimum wage for fast food workers. Think about that for a moment. Lower, $1.50. So why do we find ourselves in this situation? It's actually pretty simple. For decades, New York has not made the investment into our field, as you've heard today. We've literally gone the last decade without an adequate cost of living adjustment, has not kept up with inflation, has not kept up with rising costs. We estimate conservatively that that lack of investment has stripped away $5 billion, that's with a B, billion dollars from our field in the last decade. At the very same time we have not made our investment into this field, we have enacted a number of different cuts as well, including the one you've heard of today, the May 1st, 2021 cuts, which is slated to take out an additional $230 million out of our residential system. Implementing those cuts is not only unnecessary, it is unconscionable. Without funding, we cannot offer competitive wages. Without competitive wages, we cannot staff our programs and services. And without staff, we cannot sustain our system of supports and fulfill our commitment to New Yorkers with IDD. You've heard all the statistics today. They are sobering, and the situation is dire. What do those numbers, though, really mean for the people that we serve? Programs are closing, opportunities for growth, independence, and integration are being lost, continuity of care is suffering. Providers are also terrified at the loss of any more employees in the wake of a potential vaccine mandate. They are preparing contingency plans, which include closing residences, doubling up bedrooms, closing homes, leaving homes vacant. Literally, programs are at razor-thin staffing levels. We have partnered with New York State to build a robust system of essential supports and services to realize social justice and ensure integration for New Yorkers with IDD. The services we deliver are the cornerstone of that commitment, and the workforce is its foundation. And it's clear to say that that foundation is eroding, and without it, the entire system is destabilized. We need immediate action from the state to address the current crisis and implement long-term solution for IDD sector's workforce challenges. We've collaborated with NIDA, and we've submitted a number of recommendations to all of you, to the Chamber, and to OPWDD, and that came out in July. First and foremost, as you've heard, we need to secure and maintain a living wage for our workforce. We must be included in the statutory annual COLA, which we have not seen in a decade. And while the federal funds that are flowing into our state are welcome, they are one-time monies, and we will need to sustain those long terms. And we must address the unfair discrepancies between the salaries of the voluntary sector and the state workforce. I was surprised to learn today that the commissioner announced a nice increase in salary for the state workforce. That's great for the 20% of the workforce that's going to get it. That's really bad news for the other 80% who are going to fight for the scraps from the table now. It's just not sustainable. We've also submitted today with our written testimony a number of recommendations to reform and modify unnecessary regulations. It suggests and proposes opportunities for regulatory relief, and they have been submitted as a separate report with our written testimony to both you and the Chamber and OPWDD. So in closing, many times at hearings like this, we talk about our workforce at a 20,000-foot level, kind of a policy level, and we really don't capture the human element here. Our workforce is made up of thousands of direct care workers. What they do each and every day, not to mention what they did during COVID, ensures the health, well-being, and opportunity for 140,000 vulnerable people in New York State. They are the unsung heroes of our system, and we owe them more than just a debt of gratitude. We owe them a living wage, and I hope we can have your commitment in trying to accomplish that.
Thank you. I will answer your question, which is yes. You know, I think Senator Martucci and I and the other senators who were here are committed to that. We know that it has to happen. We know that it's going to break. And you know, I don't have a question because every statement you made is really absolutely spot on. And I've been through one budget negotiation, as has Senator Martucci. And, you know, we've got to do better. And the enormity of that budget and the things that we talked through to fall short in this area and have fallen short for a decade, like you said, is an embarrassment. It's unsustainable and it has to change. And I think you have all done a great job of getting people's attention, of shaking the beams and, you know, forcing people to listen. And it hasn't just started. I know that it's happened for a long time, and my commitment is there. And I hope and believe that from what I've seen from the new governor, that she is listening to the people that actually do the work, and she's listening to the leaders. And, you know, I know where my priorities are, and I have 5 priorities, and this is one of them, and it has to be to make sure that there is a different mindset and a statutory commitment to moving forward. So, thank you.
Great.
Yes, Senator Mannion is absolutely right. And I want you to know, too, that we are focused on making sure there is parity between our state employees and those folks who are working for our not-for-profits, because that certainly is very important. As you said, Dr. Kastner came here with good news today, but unfortunately, that gap only exacerbates with that news. So one of our focuses has to be during this process to make sure that we build in mechanisms that way there is parity for your folks.
Well, thank you both, and we look forward to partnering with you to get it done.
I know you do. Thank you, Eric. Our next witness is Melissa Stickle from the New York State Conference of Local Mental Hygiene Directors, and next following her would be Ryan Price.
Good afternoon. Again, I'd like to thank you for this opportunity to testify before you. As stated, my name is Melissa Stickle. I'm the Director of the Department of Community Services in Sullivan County and also Chair of the New York State Conference of Local Mental Hygiene Directors Developmental Disabilities Committee. I have to say that the speakers that came before me gave you an outpouring of what the issues are, so I'm not going to be redundant in stating those. I am going to let you know that the conference overall represents all directors throughout the Department of Community Services and county commissioners throughout the state regarding mental health and all disabilities. We work very closely with all providers in our communities as well as all state organizations, so we come to the table as a partner in this initiative. So in sharing that, what I'd like to do is, rather than sharing the concerns that have been noted, I wanted to kind of bring up some of the suggestions that we're willing to work on and look at. As the conference, we're offering the following proposals. Increase of minimum wage to a living wage, as noted. Create a path for career advancement. Utilize state and federal resources to offer incentives to promote workforce recruitment and retention. You can do this through a sign-on bonus, student loan forgiveness programs, tuition reimbursement, reimbursement for advanced certificates and opportunities, which someone had mentioned earlier regarding the person's experiences in the field. Funds to agencies to pay for training opportunities so these people can do what they need to do, even beyond what they're already doing. Specialized payments to provide hazardous pay, overtime, and shift differential to the workforce who continue to deliver services and ensure safe delivery of those services. Also addressing equality, equality, diversion, and inclusion for all individuals and leadership opportunities for minorities as well as those working in self-directed services. Identify effective treatment models and effective interventions resulted in decrease in serious medical conditions, criminal justice involvement, crisis, and ER visits. really providing the appropriate trainings and educations for the individuals doing these service. Reimagine a system of care, no wrong door, really a co-occurring initiative. Again, in the field as a DCS, I work with individuals from all different spectrums, from mental health to developmental disabilities and drug and alcohol. We can't cut the people. We can't keep dividing them. We have to really work and solve this issue. Some of the other recommendations that we make, and we're really willing to sit at the table with anyone to create these things, is creating a formalized policy process guidance with OPWDD, OMH, and OASIS regarding the treatment of persons with co-occurring disorders. Also work with these 3 agencies to create a screening tool to appropriately assess individuals and the needs that they have when they're coming in through the doors. Create a specialized team of experts to assist with consultations and the coordination and process and treatment options for persons with co-occurring disorders and what they require. Build capacity and expand mental health for these individuals, integrate a crisis response for all. In the field, I've seen people that are coming in and unfortunately end up in our EDs, and they have multifaceted, they're very complex care cases. And where we can get these services for these individuals, how can we help them? Also expand day programming for individuals so they have the opportunity to do things out in the community. Add a behavioral health substance abuse liaison to the New York State Crisis Services for individuals with intellectual or developmental disabilities. Creation of short-term crisis respite opportunities for individuals when those families and individuals need a break. OPWDD should investigate a Health Home Plus model to treat higher need individuals such as persons with co-occurring disorders. Achieve full continuum of care that includes inpatient short-term stabilization and outpatient step-down programs like Our Lady of Victory Children's and Kings County models, and maybe duplicate some of those services. Also, some developmental disabilities and behavioral health crisis unit. The unit might not need to be staffed at a 24/7, 365, but ready and able to serve the individuals in crisis. Again, having individuals showing up in the ED when they're decompensating or having issues and then having nowhere to go. And also explore adjusting the eligibility determination process. Licensed professionals in the field make that eligibility determination in OMH and OASIS. Having those people, we have people in the field that have been there a long time. They have expertise and being able to use them. And continue training for law enforcement and EMTs on best practices when encountering an individual with intellectual and developmental disabilities or mental health and substance abuse disorders, and providing those evidence-based trainings and support for them as well as they encounter these individuals in the community. Thank you.
Thank you very much. I appreciate all of that. Lots of recommendations there. Along the lines of dual diagnosis, have you seen, and I would guess certainly there's more attention to this, but I guess what victories have you seen in that area maybe over the course of the last 5 or 10 years? Are we better at it? Because it seems like we're better at it. It seems like there's a better acknowledgement. And I know that's a wide-ranging question, but
I'm going to be very honest with you.
Yeah.
There's a lot of talk that says we're better at it, but as far as witnessing and seeing it and seeing the success to come through, I can't say that that's the case.
Right, and that's probably where your, one of your closing statements was about the qualified personnel that we already have and we're not utilizing.
Yes.
Okay.
Exactly.
That's all I got. All right, excellent. I just want to say thank you for making the trip here and thank you for your testimony today. You have some great solutions here and I look forward to chatting with you more about them in the future.
As do I. Thank you very much.
Thank you. Thank you. Our last witness of the day is Ryan Price from New England Joint Board of Unite Here.
So I'm going to take my mask off like everyone else is. I have a little cough. It's not Corona. It's fine. So what I'm going to do here is introduce myself and the union, and then I'll get into recommendations, and I have a couple of stories from our members too. So my name's Ryan Price. I'm a union representative for the New England Joint Board of Unite Here. NEJB represents about 10,000 workers from New York to Maine in all kinds of different industries, but in New York, we solely represent workers in the disability and mental health care facilities. For about 15 years, we've represented those members. We have about 2,000 within the industry. My job is solely to represent those members. So I think we all know that workers in this industry leave because the pay is low, the work is really hard and dirty, and we're overworked and abused. But something that hasn't been said much here is that people stay because they fall in love with the individuals, right? And that love, how we feel about the people we care for, is largely exploited by the employers, but also by the state as well. Those workers feel the problems of this industry really directly and have solutions to fix them. The stories I'm going to tell aren't unique. They're just a couple kind of entertaining stories. So I'd encourage the committee to seek out more workers, keep hearing their stories, keep having testimonies like this where you can hear directly from workers. And if you ever want to come to the facilities and talk to them, I'd encourage you to do that. So in here, I wrote that we have 3 key changes to recommendations to improve staffing in this industry. I'm actually going to pitch a 4th, but we'll see how it goes. The first is mandate a prevailing wage rule in the industry to tie wages for private employers to state employees' wages to create a fair wage floor while protecting jobs. I'm not just talking about the hiring wage here. I would recommend that you also do the longevity increases. Hopefully it'll help manage that, the compression issues that we're having, and it'll help protect state workers' jobs as well as create a fair wage floor. Second is give workers some agency over the changes in care ratios and/or implement safe staffing ratios similar to what is in the nursing home and hospital sectors. The stories I'm going to tell, they're all related to changing care ratios. It shouldn't be happening, but it is. And then the third is mandate safety training by third parties for DSPs and residential care facilities. The other thing I wanted to touch on from Mr. Stasio's testimony is that maybe we want to start talking about hiring halls. You shouldn't be having to approach people in grocery stores to try to get them hired. Like, you should be able to reach out to, I don't know, agencies or unions to, find people that are already trained, to get into the industry and care for you. So, in the height of the pandemic, one of our members, her name's Millie, she works at a facility called Laurel Road. She works with an individual, he's a big guy, and one of the things that he likes to do is throw himself out of his chair. It's just what he does. After eating a lunch Millie made, he did just that. Now, pre-pandemic, that house always had 3 workers in the facility at all times, but the company used the pandemic to reduce the ratios to 2 workers. The other staff member was in the bathroom showering his individual and couldn't hear Millie's calls to help with lifting, and so it's supposed to always be 2 people lifting, 1 person at one time. So, she tried to do it herself. Now she's out on workers' comp. She's been out on workers' comp for about 3 months. She might have to go out on disability, permanent disability. I'm not going to have time to get into the other story, so I'm not going to do that.
That's okay.
So I'll end it there.
It's the end,
Yeah.
and, it's not the end. What I'm saying is, I'm sure you probably are not around the corner, and I want you to make sure you share those.
Yeah, I got to get back down to Brooklyn. So.
Yes, right. So, please share.
Okay.
Please keep going. I said the end, but that's,
Yeah.
there's a lot of flexibility in that word somehow.
All right. So another location, so our local union secretary, Deja, she works at a location called North Road, which is in the middle of, there's like a steep hill that goes up, there's no sidewalk on it, and then there's a steep winding road down the other side. There's about 6 individuals at this house, and before the pandemic, there used to always be 4 workers in the house at all times. The company used the pandemic to reduce the staffing protocol to 3. Some of those individuals were two-person transports, so if they have to go out on a doctor's visit or whatever, 2 people are gone, so there's only 1 person left in the house. So one day, one of the individuals had an appointment. Deja was the only person left at the facility, and while on a mandated double shift, she was there alone. One of the individuals needed help bathrooming, and after she gets out, she does a head count of all the individuals, and she realizes that one's missing. This individual who is in the house because he had a traumatic brain injury from a car accident, he can get out of the house on his own, and he doesn't have a powered wheelchair. He moves himself by his feet, and he's really fast at it. But Deja looks out the window. She sees him going up the hill towards a long winding road, just booking it as fast as he can. Deja had to make the decision of like, am I going to abandon everybody that's in this house now to go get this guy, or let this guy go down this hill and hurt himself? So she decides to obviously go and get the individual. And after sprinting after him uphill, the neighbors are outside watching her and laughing at her. She gets him, goes back, and everything's fine, but she was terrified coming out of this. And she shouldn't have ever had to make that choice in the first place. Care ratios are supposed to be based on what the individuals need, not what the agencies need. So we didn't encourage the state to stop that behavior. That's it. I appreciate your time.
Yeah.
Hope we get to have more of these.
Yes, thank you, Ryan. I appreciate that, and I think you highlighted as we are reaching the end for real, the chain reaction or the snowball's effect or whatever we want to call it, that is due to the underfunding, which is, I think you highlighted many of those, as did others, that when we have fewer people and we have to make difficult decisions, and those difficult decisions mean fewer staff, then we're putting the people that we're caring for at greater risk. And the people that do that work, that are subjected to that greater risk and more challenging work environment, then leave, and you have higher turnover. And that brings it all back, I think, to the people that have these relationships, and that the relationships are not as strong because we can't keep people in this field. And since we've underfunded it, honestly, rightfully so. So that's just one small bucket, but I think you really summarized, and I think it's a good place to end, the anecdotes of the fact that we are really in a situation where we're putting lots of people at risk, and they should not be at risk, because we should be a society that values all people and values the people that work with some people who need some support. So I appreciate you coming here today and your advocacy for your members.
Yeah, thank you, Ryan.
Thank you, everybody. It has been a long 4.5 hours, but it's nothing compared to the work that's being done by our DSPs that are out there, and it's necessary work. And for those of you that traveled a very long way, and then for those of you that stuck it out at the end, I said I hope it doesn't fall on deaf ears earlier, but you know what I mean, is that I hope people are listening. They have to listen. They have to listen. The new governor has to listen. Our leadership does. Leadership in the assembly. Of course, the office has to as well. And we need a complete commitment for this. And I think we're there. I hope we're there. And I know the folks in this crowd and the folks that were here before are just not going to stop. Senator Martucci, if you want to give a brief statement, and then I'll give a brief one, and then everybody can stop dreaming about the lunch they missed.
Yes, so Since I'm the second to last thing that stands between you and lunch, I will be brief. Certainly, first, thank you, Senator Mannion, for holding this today, and to your team for putting this together. Thank you to the many folks who took time out of their busy day to be here and share with us your important perspective on the challenges that we face together. And I will just end by saying I look forward to working with Senator Mannion as we have this past year. I think that he has a very clear plan that he's shared with me. I look forward to being a partner with him in making sure that we can deliver the resources necessary to solve this important problem. So thank you, Chairman.
Yes, thank you, Senator Martucci. I know I think we have a great working relationship, and we're committed to the cause, and both of us being freshman senators, maybe, we don't know any better than to speak up and keep yelling, and hopefully that has, done us some good, and we have a long way to go. As I was out screaming outside today, this is an emergency, and it's a crisis, and it's an embarrassment, and we can't have it anymore, I took a lot of takeaways. I'm not going to be able to summarize them in 30 seconds, but I'm going to try, which is the key is that we need to focus on person-centered services and respect the individuals that need those services. They know what works best for them. And we need to focus on the workforce too, those people, and how we're not centering on what really they need to stay in this profession. And of course, that means a living wage. It means a commitment to it, a commitment in writing. And, the vocation is there, the relationships are there. Ryan Price just said it, that we are relying on those relationships. I'll give my quick story, not a personal one, but a friend's, and I may have said it via Zoom. His sister passed away recently. She was about 50 years old. She had a disability from the time she was born. She lived in a residential facility, and when she passed away, her home was out past Oneida, and we were in the other side of Syracuse, west side of Syracuse, in a town called Camillus, which some of you, I'm sure, are familiar with. And unfortunately, it's during the pandemic. Not a lot of people come to a wake, and you need time as a family to go through that. But it was getting near the end, and 4 DSPs got in a car and drove from the other side of, all the way to the other side of Camillus from Oneida. It was probably an hour away. And let me tell you, that family was there a long time, and I happened to be there for part of it because their emotions just poured out of them. And it is a disservice and really just an awful scenario to rely on people's goodwill who are so dedicated to serve others in our world. And that's something we've got to do better on. So we have to sustain this field. We have to keep it going, which means we have to invest in it. And we can't, and I say $500 million. That $500 million has to stay in the state budget year after year after year after year. It has to be a multi-year commitment. It needs to be balanced across, state operated and private. And we have to value not just the DSPs, but everybody that works in this world, and make sure that the agencies also can sustain themselves. So we can't just say we have to put this minimum wage. We have to fund it. We have to fund it robustly. And it's because the people who proudly say that they're an individual with an intellectual or developmental disability, they deserve it, just like we all do. So thank you all for your commitment to the cause. We fight together, and we fight for another day.